Keith Egli.
As usual, having trouble with my mute button.
And we are live, Chair.
What's that?
We are live.
Excellent. Okay, thank you. Thank you, everybody. This is an experiment for us, a necessary one, unfortunately, due to the circumstances we find ourselves in with COVID-19. So I ask everybody, please, to be patient as we try and do this all over the telephone. We believe that with the good help of Deanne, our clerk, we're going to be able to get through this and get through this well. So I want to thank her to start for all the prep work that she's done to make this a possibility for us. So thank you for that, Deanne. The first thing that we have to do is, as this meeting will be held through electronic participation in accordance with the Municipal Act 2001, as amended by Bill 87, the Municipal Emergency Act 2020, and an order in Council of March 28, 2020, which amended the Emergency Management and Civil Protection Act, prohibits organized public events of more than 5 people. And so that's why we are doing the meeting as we are doing it. I remind members to please keep their phone on mute at all times unless called to speak. And please do not put your phone on hold, because if you do that, then we will get hold music, which will not be helpful. If you can, avoid using the speakerphone when speaking, and please speak directly into your telephone receiver. I'm going to ask the Board Secretary to conduct the roll call now, please.
Member Banham?
Present.
Member Cloutier?
Present.
Vice Chair Di Giovanni?
Present.
Chair Egli?
Here.
Member El Shanteri?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Menard?
Present.
Member Pinel?
Present.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. We have no regrets. I'm now going to go through again the procedure a little bit for the meeting. First of all, should any member need to leave the meeting, they should advise verbally that they're doing so before ending their call, because we have to keep track of quorum, and we will need you to hail in order to do that properly. In terms of if anybody wants to speak to a matter, I will provide each member with an opportunity to ask questions or comments. Members will be called on to speak in the order set out in the Board Secretary voting list, and we will have the usual 5-minute limit for speaking. Should you not wish to speak on any given matter, you may simply decline when your name is called. For voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all votes are properly registered. Should anybody have a point of order, a point of privilege, or a challenge of some sort, we'd ask that these obviously be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. We may have to call a recess should any technical difficulties or unforeseen matters require that. And however, unless you are given different instructions by our secretary, Deanne, you're requested to please stay on the line with your phones muted during the recess period. Are there any declarations of interest? Okay, thank you very much. Before any vote can be taken on any other matter, I'm going to ask Member Menard to please introduce a motion listed as item 1 on the agenda and call for a vote on that motion. Member Menard, over to you, please.
Thank you, Chair.
Be it resolved that the rules of procedure be suspended to permit the introduction of the following motion in order to respond in a timely manner to the restrictions in place as a result of COVID-19 pandemic. And be it further resolved that the rules of procedure be suspended to provide that members of Board of Health may participate in consideration of and vote on the following motion through electronic participation by way of telephone at the special meeting of the Board of Health on April 20, 2020, in accordance with subsections 238 to 3.1 to 238 3.4 of the Municipal Act. There are a number of whereas clauses, Chair. Do you want me to read through every single one or go to the be it resolved?
I'd like to please read them all if you would, Member Menard, since this is something we've not done before. I think we want to have everything on the record if at all possible.
Okay, will do. Whereas COVID-19 pandemic continues to evolve and is causing significant effects across the world and in the city of Ottawa, whereas the ongoing COVID-19 situation, the associated recommendation from OPH with respect to physical distancing and Government of Ontario restrictions with respect to group gatherings of more than 5 people mean that it is not advisable for members of the Board of Health to attend the Board of Health meeting of April 20th, 2020, as well as other Board of Health meetings in an unknown period of time thereafter. And whereas subsection 238 3.1 of the Municipal Act, as amended by Bill 68, the Modernizing Ontario Municipal Legislation Act 2017, provides that a municipalities or local board procedure bylaw may provide that a member of council. Folks can just put their phones on mute. A municipality or local board's procedure bylaw may provide that a member of council of a local board of a committee or of either of them can participate electronically in a meeting which is open to the public to the extent and in the manner set out in the bylaw, provided that such member shall not be counted in determining whether or not a quorum of members is present at any point in time. Whereas on March 19, 2020, Bill 187, the Municipal Emergency Act 2020, received royal assent and amended the Municipal Act 2001. So municipalities or local boards procedure bylaw may provide that during any period where an emergency has been declared to exist in all or part of the municipality under Section 4 or 7.0.1 of the Emergency Management and Civil Protection Act. 1. A member of council of a local board or of a committee of either of them who is participating electronically in a meeting may be counted in determining whether or not a quorum of members is present at any point in time, the new subsection 238 3.3a of the Municipal Act. And 2, a member of council of a local board or of a committee of either of them participate electronically in a meeting that is closed to the public. Whereas subsection 238 3.4 of the Municipal Act, as amended by Bill 187, provides that a municipality or local board may hold a special meeting to amend an applicable procedure bylaw for the purposes of subsection 238.3.3 of the Municipal Act 2001 during any period where an emergency has been declared to exist in all or part of the municipality under Section 4 or 7.0.1 of the Emergency Management and Civil Protection Act. And despite subsection 238.3.1 of the Municipal Act, a member participating electronically in such a special meeting may be counted in determining whether or not a quorum of members is present during the meeting. Whereas on March 17, 2020, an emergency related to COVID-19 outbreak was declared in the whole of the province of Ontario, pursuant to section 7.0.1 of the Emergency Management and Civil Protection Act, as set out in Order in Council 5/18/2020. Whereas the chair has convened the Board of Health meeting of April 20, 2020 as a special meeting of the Board of Health as permitted under the new subsection 238 3.4 of the Municipal Act. And whereas the Board of Health procedure bylaw does not provide for electronic participation at meetings of the Board of Health, 7 of the procedure bylaw requires that when the chair calls for a vote on a question, each member shall occupy their seat until the rest of the vote has been declared by the chair, and that, quote, a member not in a seat reserved for the board at the time that member's name is called shall not be entitled to vote.
Sean, Member Menard, I'm just going to interrupt for a minute. Somebody, I think at least one somebody has their phone not on mute. Could you please all make sure that your phones are on mute so we can hear properly? Thank you.
And whereas under the current circumstances relating to COVID-19, allowing members of the Board of Health, to participate electronically in a meeting of the board pursuant to the board's discretionary authority under the Act would provide an opportunity for members unable to physically attend the meeting to participate and exercise their statutory roles and responsibilities as members of the Board of Health. And whereas staff recommend that in consideration of the current circumstances, electronic participation at a meeting of the Board of Health should include the following parameters. 1, while a quorum of 6 members may be physically present at the meeting, any member participating electronically can be counted in determining whether or not a quorum is present, as permitted by statute. 2, a member shall be permitted to participate electronically in a meeting which is closed to the public as permitted by statute. 3, electronic participation shall be conducted by way of telephone following instructions provided by the board secretary in order to ensure that the meeting may proceed in the most transparent and successful manner under the current timelines and circumstances. And 4, subject to the above noted parameters, a member who participates electronically shall have the same rights and responsibilities as if they were in physical attendance, including the right to vote. And therefore be it resolved that the Board of Health approve that the procedure bylaw number 211-1 be amended to provide for members to participate electronically in the Board of Health meeting of April 20th, 2020, and in all meetings of the Board of Health held thereafter, while the emergency declaration set out in Order in Council 518-2020 remains in effect pursuant to subsections 238.3.1 to 238.3.3 of the Municipal Act 2001 and in accordance with the parameters described in this motion. And be it further resolved that the board waive the requirement under section 27 of the procedure bylaw as described in this motion, so that when the chair calls for the vote on a question, any member participating electronically at that time shall be entitled to vote. And be it further resolved that in order to respond to evolving circumstances, council suspend the notice requirements set out in subsection 762 of the procedure bylaw, such that these emergency provisions may be amended or revisited by a majority of the Board of Health at a future meeting. And be it further resolved that while the emergency declaration set out in Order in Council 518-2020 remains in effect, all Board of Health meetings may be convened as special meetings in accordance with Section 14 of the procedure bylaw, as amended by the following. A, agendas shall be limited to items that, in the opinion of the chair, informed by the medical officer of health and operational staff, are of a time-sensitive nature or pertain to a legislative requirement such that it should be considered during the emergency period. B, subject to the minimum 6-hour notice provisions in the procedure bylaw, the chair and the board secretary shall endeavor to publish agendas in accordance with the timelines for a regular meeting and where not possible, with as much notice as possible under the circumstances. And C, that during the emergency period, additional items may be added to such special meeting agendas with less than 6 hours notice, with the approval of 2/3 of members present and voting, instead of the unanimous consent currently provided in subsection 14.5 of the procedure bylaw. I believe that's the end of that.
I believe you are correct, and thank you very much for doing that. That was, you can take a breath now. So if I could ask the board secretary to call a recorded vote, please.
Yes, Chair. Member Benham,
Agreed.
Member Coutier,
Oui. Yes.
Member Alchandjeri,
Yes.
Member Gower,
Yes.
Member Kavanaugh,
Yes.
Member Lakin,
Yes.
Member Menard,
Yes.
Member Pinel,
Oui.
Member Tilly,
Yes.
Vice Chair DiGiovanni,
Yes.
Chair Eglai.
Yes.
The vote is unanimous, Chair.
Thank you very much. Could we have a confirmation of the minutes of the meeting of February the 10th, 2020, please? Carried?
Carried.
Carried.
Any
Carried.
dissent? Okay, thank you. Communications are noted as been received. Can we receive the communications as noted in the agenda, please?
Carried.
Okay, thank you. No dissents on reception then? Okay. Can I ask Councillor Menard again, or Member Menard rather, if you can please move the motion to introduce reports?
Yes, Chair. Be it resolved that the chair of the board, motion to introduce reports. Be it resolved that the chair of the Board of Health verbal report, the medical officer of health verbal report, and the reports titled Ottawa Public Health Submission to the Government of Ontario on the potential for cannabis consumption establishments and or cannabis special occasion permits. Ottawa Public Health Submission to the Ontario Ministry of Health on proposed vaping regulations. Ottawa Public Health Strategic Plan for 2019-2022. Update from quarter 4 of 2019. Ontario Ministry of Health Accountability and Reporting Requirements, Q4 2019 Standard Activity Report, 2019 Operating Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, and Delegation of Authority contract awarded for the period of July 1st to December 31st, 2019, be received and considered.
Sorry, carried.
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 No dissents? Thank you. And thank you, Member Menard, once again. I'm going to go through the consent agenda now. Any held items will be dealt with in the order in which they appear on the agenda. So first of all is my verbal report, which will hold as there's a motion attached to it as well. That will be followed by Medical Officer of Health verbal report, which will also hold, and as there are additional motions with that as well. Next is Ottawa Public Health submission to the Government of Ontario on the potential for cannabis consumption establishments and or cannabis special occasion permits. Carrie?
Carried.
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 Consent? Thank you. Next is the Ottawa Public Health submission to the Ontario Ministry of Health on proposed vaping regulations. Carried?
Carried. Carried.
Carried.
Any dissents? Thank you. Next is the Ottawa Public Health Strategic Plan for 2019 to 2022, update from quarter 4 of 2019. Received?
Received. Received.
Received.
Thank you. Next, Ontario Ministry of Health Accountability and Reporting Requirements, quarter 4 of 2019. Carried or received rather? We just did that one, didn't we? I'm sorry. Ontario Ministry of Health Accountability and Reporting Requirements Q4 2019 Standard Activity Report. Received?
Received.
Received.
Okay, thank you. Next is the 2019 operating budget year-end results, Board of Health for the City of Ottawa Health Unit Status Report received.
Chair, Member Cloutier here. I had just one very quick question, if you'd entertain that at this time.
If it's very quick, yes, I think that makes sense. Thank you.
It's very quick. Lou, are you on the line?
Yes, I am.
Thank you. On item in our package 08A, document 1, the actual revenues for an item are a difference of $1.096 million of additional revenue for the item. It's about halfway down substance abuse. The projected revenue was 1.1 million. The actual revenue was 2.2. Can you tell, while the expenses were about the same, can you tell us the nature, why we received more money? I presume it was from the province.
Yeah, most of that revenue, just under $1 million for that line related to cannabis revenue. So in 2019, we didn't have a base budget for cannabis, and so we were tracking costs throughout the year, and we also were looking to get it funded, and it did. So it was funded one time in 2019, and then we came forward with a budget pressure for 2020 of $500,000. So there was more costs and more revenues in 2019 as they related to ramping up the cannabis program, and it was fully funded by the ministry.
So all of that was funding from the ministry because of the expenses of the municipality to roll out and to enforce, not to enforce, that would have gone to bylaw. Was this for education or?
It was a mix. It was mostly for education, promotional programs, but there was a level of enforcement also within that number. I believe about 200,000 was also built into that number for bylaw enforcement.
Thank you very much. Thank you, Chair. I have no other questions.
Okay, thank you very much. Can we receive that then?
Received.
Okay, thank you. Next is the delegation of authority contracts awarded for the period of July 1st to December 31st, 2019. Received?
Received.
Received.
Okay, thank you. So I'm going to go back to the first item that we held then, which was my verbal report. And again, there'll be a motion coming from that. So good evening, bonsoir, que rather. Thank you all for joining us tonight for our first ever virtual meeting of the Ottawa Board of Health. Before I get into the verbal report, I want to take a moment to acknowledge the terrible tragedy that has unfolded in Nova Scotia over the weekend and to offer heartfelt condolences to the many families, friends, colleagues, and communities affected. As part of my verbal report tonight, I will be bringing a bit of good news, providing an update on the city's response to COVID-19 and reporting on some recent discussions with the Renfrew County and District Health Unit. First off, Femmes Remarquables, Ottawa Distinguished Women is a collaborative volunteer initiative currently comprised of over 50 community leaders from various cultural communities and backgrounds with a shared passion for creating a lasting legacy and conduit for recognizing the outstanding contributions and professional achievements of exceptional women in Ottawa. Last month, my office was advised that Heather Crow was being recognized for her lifetime contributions following a nomination I submitted last year, which was supported by Dr. Etches. For those who may not be familiar, Heather Crow is a driving force protecting us from all secondhand smoke, and Canadians across the country are privileged to be living in smoke-free environments thanks to her determined efforts and unwavering legacy. Heather worked in an Ottawa restaurant as a waitress for decades, and having never smoked a day in her life, in 2002 she was diagnosed with lung cancer. At the time, smoke-free policies in restaurants were practically non-existent, leaving those workers exposed to the harms of secondhand smoke. Heather fought hard to change these policies, but succumbed to cancer in 2006, just 4 days before the Smoke-Free Ontario Act came into effect. When Heather Crow began her campaign, only about 5% of Canadians lived in places where every worker was protected from secondhand smoke. 4 years later, laws were in place to protect 80% of Canadians from secondhand smoke in their workplaces. Heather Crow was truly outstanding in her selflessness and commitment to a bigger cause. Her contributions have left each and every one of us with the assurance of living a healthier life free of harmful secondhand smoke, greatly reducing that concern for our future generations to come. Her public service was both courageous and altruistic. We are grateful for her legacy and for recognition by Femmes Remarquables, Ottawa Distinguished Women. Next, I want to take an opportunity to update board members on the city's response to COVID-19. I'd like to extend my heartfelt thanks to all staff of Ottawa Public Health, under the leadership of Dr. Etches, for the incredible work that they are doing in our community to respond to this pandemic. Let's also not forget to thank their loved ones who may be supporting them through these times, taking on extra tasks at home while they put in countless hours. I wanted to also share my thanks for our entire community for following the important guidance provided by Ottawa Public Health and for coming together to support one another in this unprecedented time. We have seen neighbors, businesses, and community groups bring forward innovative ways to stay connected and support each other with essential needs. I'm incredibly proud of this city and how we have responded to this pandemic together. I want to share a little story with you about that. While out walking the other day, I passed a driveway which had, we'll call it a dad joke on it, written by one of the children, and asked, "What do you get when you cross an alligator with a vest?" The answer was, "You get an investigator." Well, I took a picture of that and I posted it on Twitter, and it had over 10,000 hits or responses on it. So it was just a quick and easy way of sharing a cheery message from someone in my ward with the rest of the city. And we see more and more of that as these days of isolation go on. So I want to thank everybody for contributing in their own little way. As you know, on March 25th, Mayor Watson declared a state of emergency for the city of Ottawa, which aligned with Premier Ford's announcement about expanding the province's statement of emergency by shutting down all non-essential services. Declaring a local state of emergency helped the city to deploy its emergency operations and staff in a more nimble fashion, and enabled a more flexible procurement process for the purchase of equipment and the resources needed by frontline workers and first responders. At the same time, City Council approved a property tax relief package and the grace period for the payment of water bills to provide relief for residents and small businesses impacted by COVID-19. While all parks and their amenities, such as sports fields and courts, play structures and park equipment are closed by provincial order, the city has also closed municipal facilities and services such as recreation centers, childcare centers, OC Transpo, customer service centers, public library branches, theaters, in-person public consultations, and more. The city's bylaw services have been enforcing rules with respect to city parks and amenities, as well as any restaurants continuing to offer dine-in services, whereas the Ottawa Police Service is providing enforcement with respect to the Quarantine Act and any businesses operating without an exemption. The city has continued to support residents experiencing social isolation, homelessness, and those who are at risk of becoming homeless through emergency shelters, support services, and outreach, while our housing providers are checking in with vulnerable tenants over the phone. We have established a human services task force to ensure we are responsive to the emerging needs of the community and have opened the Routier Community Centre in Lowertown as an isolation centre to help protect Ottawa's homeless population. The city has also created an economic partners task force, which is co-chaired by Mayor Watson and Councillor El Shantiri, also a member of our board. This task force has been advising city staff on how we can help the business community as this pandemic evolves. In partnership with the task force, we have launched an online promotional campaign to encourage residents to support local small businesses by doing things like shopping, local online, buying gift cards for later use, or ordering delivery or takeout from locally owned restaurants. On April 9th, Mayor Watson hosted a virtual town hall. Participants included myself and Dr. Etches, as well as City Manager Steve Kanalakis, the General Manager of Emergency and Protective Services, Tony DeMonte, and Chief of Police, Peter Slowly. It was an opportunity to provide an update to the public and to answer residents' questions about the city's response to COVID-19. And most recently, the city launched 3 provincially funded emergency childcare services for essential and critical service workers at no cost to families. These services are being offered. Sorry, I've lost my place here for a second. These services are being offered at 3 locations, one in Ottawa's East End, and one in the West End, and one in the South. Lastly, the topic of public health modernization has been front and center for the past year, with updates having been provided on the subject at every board meeting since April of 2019. Members will be aware that as part of the Ottawa Public Health's formal written submission to the province, one of the key themes focused on the establishment of regional service and collaboration hubs to improve consistency and equity of public health programs and service delivery across Ontario to ensure system sustainability. In late February, Vice Chair DiGiovanni and I met with the representatives of the Renfrew County and District Health Unit Board of Health to discuss opportunities for collaboration between our 2 health units. And on March 31st, the chair of the Renfrew County and District Health Unit Board of Health followed up with a letter indicating that their board would welcome the development of a collaborative approach to become stronger together. Board members will have received a copy of that letter along with their agenda package for today's meeting. As a result of these discussions and in light of the ongoing COVID-19 pandemic, which has highlighted the importance of a strong, collaborative, and consistent public health system, I'm recommending that this Board of Health formally express its support for exploration collaborations with Renfrew following the current COVID-19 emergency response, and that in the interim, we authorize OPH's senior management team to work with Renfrew County and District Health Unit's senior staff to enhance collaboration where feasible. I would now ask Member Menard to introduce a motion to that effect, after which I would welcome any questions or comments from board members before proceeding to a vote on the motion. Over to you, Member Menard.
Thank you, Chair. Whereas throughout this past year's discussion on public health modernization, Ottawa Public Health has looked for and explored opportunities for greater collaboration amongst local health units in order to increase public health program and service capacity and to leverage resources and expertise. And whereas one of the key themes discussed in OPH's written submission to the Ministry of Health in response to public health modernization consultations focused on the establishment of regional service and collaboration hubs to improve consistency and equity in public health program and service delivery across Ontario to ensure system sustainability. And whereas in late February 2020, the Chair and Vice Chair of the Ottawa Board of Health, Councillor Eglai and Tammy DiGiovanni, met with representatives from the Board of Health of the Renfrew County and District Health Units to discuss opportunities for collaboration between these two neighboring health units. And whereas on March 31st, 2020, the Chair of the Board of Health for the Renfrew County and District Health Unit, Ms. Janice Wisniewski-Moore, wrote a letter to Chair Eglai expressing her board's hope that moving forward, the two organizations would be able to develop a collaborative approach in order to become stronger together in providing public health to residents of both jurisdictions based on efficient use of resources and public health best practices. Whereas Chair Wisniewski-Moore's letter also expressed a desire to meet again to continue discussions regarding the potential collaborative approach to providing public health services in Ottawa and Renfrew County and District. And whereas in addition to OPH's recommendations to the Ministry of Health and its submission on public health modernization, collaboration is also important in the context of the current emergency response to COVID-19 because of the need for a strong response across our region. Therefore, be it resolved that through this motion, the Board of Health for the City of Ottawa Health Unit formally expresses its support for exploring collaborations with the Renfrew County and District Health Unit and its willingness to meet with representatives of that health unit following the current COVID-19 emergency response. And be it further resolved that in the interim, the Board of Health for the City of Ottawa Health Unit authorized OPH's senior management to continue to work with representatives of the Renfrew County and District Health Unit to enhance collaboration as operationally feasible and appropriate and report back to the Board of Health as needed. Chair, back to you.
Thank you very much, Member Menard. Are there any questions at all? Hearing no questions, I will go through you one by one, and you can indicate whether or not there's anything that you wish to add. Member Banham?
Nothing I wish to add.
Thank you. Member Cloutier?
Just a quick question, I guess. Does this preclude collaboration with any other Board of Health in the area that might become evident after COVID-19?
I don't believe that it would. We may have to come back to board at that time. At this point, and Dr. Etches can jump in as necessary, but at this point in time, I believe the Renfrew board is the only one that has expressed it in this way and reached out in this way to us. Do you have anything to add to that, Dr. Etches?
No, you're right. That's correct.
Okay. Anything else, Member Cloutier?
Thank you. No, Chair.
Okay. Vice Chair, any questions, comments?
No, just to say that it was a very collaborative conversation. It feels like an eternity ago, but I think it really set the foundation for some good discussions going forward. Nothing further to add.
Yeah, I think things were a little simpler back then, Vice Chair.
Agree.
Member El Shantiri.
Thank you, Mr. Chair. And I just want to say this is the right approach. We heard from the ministry and other one we met in Toronto. We are through the right direction. And to answer Councillor Cloutier, I believe we can Ottawa Public Health can offer service to other areas, not necessarily just Renfrew. But I think we are on the right track, and I want to thank all your effort, Mr. Chair.
Thank you. Member Gower.
I have no questions. Thank you, Mr. Chair.
Thank you. Member Kavanagh.
No further questions. Appreciate the collaboration.
Thank you. Member Lakin.
No questions, Chair. Thank you for that report and great efforts with Renfrew.
Thank you. Member Menard.
I don't have any questions. Happy to support this.
Thank you. Member Pinel.
Nothing to add, Chair, and thanks.
Thank you. Member Tilley.
No, good work, Chair and Vice Chair. Thank you.
So I'm taking from the comments that will carry the motion.
Carried.
Carried.
No dissent?
Carried.
And no dissent. Thank you. We will now call the vote on receiving my verbal report as amended by the motion. Carried?
Carried.
Carried. Received.
Carried.
No dissents? Thank you. I'm now going to call on Dr. Etches to present her verbal report.
Thank you. I almost feel like it's worth taking questions as I go through the slides because there's quite a lot of material here. So I'm open to that approach if people would like to do that. That said, it may also be that your question is answered later on in the presentation. So I'll just listen for any interruptions, perhaps, but I'll otherwise keep going and welcome your questions later. So I also want to acknowledge that, I'm really sorry that on top of all the challenges, losses in Nova Scotia as well, and our thoughts are with them. So, bonsoir. I will cover a lot of topics tonight related to COVID-19, which I hope are useful updates to you and the public. Ce soir, je ferai le point sur divers sujets relatifs à la COVID-19. Je parlerai de notre approche pour contrôler la maladie, des interventions non pharmaceutiques, de la façon dont Santé publique Ottawa travaille ensemble pour soutenir la communauté, des aspects opérationnels de notre réponse et d'un regard vers l'avenir pour savoir quand nous pourrons commencer à assouplir les restrictions. So I am now on slide 3, which is to highlight for the public that there are now a range of symptoms that can be associated with COVID-19 that were broader than initially advertised. Of COVID-19 captured in the case definitions included fever, cough, or difficulty breathing, or symptoms of worsening illness. But somebody is going to have to advance the slides, I guess. So I'm not sure who's doing that. I'm just going to pause for a moment. Somebody else is advancing them now. Is that okay, team?
I'm sorry to interrupt.
Yes.
Could you just direct us to where the slides are being shared from and where to direct us to view them?
Yes, I can do that. They are on a YouTube feed, and I will have to get Diane to email that to you.
Terrific. That's great. Thanks.
So, Diane, if you don't mind just recirculating that email that went to the board with the YouTube feed, please.
Diane also sent the PowerPoint around to everybody right before the meeting, so you might be able to pull up the PowerPoint and scroll through yourself without having to watch the YouTube video.
That's correct. Sure, that's true for those council members. You probably received the presentation directly. Okay. And is it there? Are they advancing? For those who are watching the YouTube feed, are we now on slide 3? Yes. Okay. All right. Good. That was a little pause. What I wanted to highlight on slide 3 is that the symptoms, especially now it's found in children or adults, may be atypical. So it could include unexplained fatigue or delirium, falls, sudden functional decline, worsening of chronic conditions, digestive symptoms such as nausea, vomiting, diarrhea, or abdominal pain. It could be headaches, a loss of taste or smell, or an unexplained rapid heart rate, decrease in blood pressure, unexplained drop in oxygen levels, or difficulty feeding in infants. And so this is part of what we're advertising to people who need to detect cases in long-term care homes and others to present for testing. So on the next slide, on slide 4, with regard to testing, we have now increased our capacity in the Champlain area to do 800 tests a day. And this is through hospitals, a number of testing centers across Eastern Ontario. And we also know that this capacity will continue to grow. We're hearing that it will be probably up to 1,000 next week. Since opening on March 13th, the Brewer Park Assessment Center in Ottawa has had over 9,700 patients registered and tested over 8,900. And this would have otherwise been handled in emergency departments. So the increase in testing is happening as the lab capacity grows. We're seeing this, and it is also related to the number of people being tested for working at a long-term care home or retirement home in outbreak. I will also highlight on this slide that the groups that are a priority for testing have grown. So they're listed on the slide. I won't go through all of them, but this is also a message for the public. If they are caring for somebody, if they live with somebody who's an essential worker or a healthcare worker, then these are also people who should be tested if they develop symptoms of COVID-19. So going on to slide 5, contact management. This is essential for controlling spread of COVID-19 in the community. Each laboratory report of a confirmed COVID case represents a person that the Ottawa Public Health team members interview and they support over their period of infectiousness. And Ottawa Public Health has ramped up its resource capacity to keep pace with the projected increase in case numbers. In order to make efficient use of these resources, it's also been necessary to develop a local case management database to replace existing manual and paper-based processes and augment the available functionality of the Provincial Integrated Public Health Information System, otherwise known as IPHIS. So Ottawa Public Health has collaborated with the Ontario Ministry of Health and Public Health Ontario to temporarily automate the daily reporting process for COVID-19 cases only, directly from our new local case management system to the provincial reporting tool. And automating existing paper-based and manual processes will not only increase our case management capacity and support provincial reporting requirements, it will also enable our case management team to work remotely and to achieve the objective of physical distancing in the workplace. So we're pending approval from Ontario's Chief Medical Officer of Health, and we will begin using this new case management system. Contact tracing follows from the case management, and it contributes to maintaining the spread of COVID-19. The manual process of identifying close contacts of infected individuals and contacting them and following up is labor intensive. During the time that it takes to identify and then reach out to close contact, people may be unknowingly exposing others to the virus. Initially, we had 19 contacts per each case in the community, and now we're down to about 4 or 5 contacts per each case. So that's encouraging. That's not the case when we have an outbreak in an institution. And so as the number of COVID cases continues to increase, so does the possibility of community spread. And we need to look at automating some of these aspects of this process so we can reduce the time to trace the contacts and therefore optimize our efforts to contain the spread of the virus. So specifically, we would like to automate identification of locations visited by infected individuals while infectious, notification of close contacts, known and unknown of infected individuals, provision of information to close contacts about the measures to take, the daily monitoring of symptoms, and support for isolation and protective measures. And there are several solutions currently in development in Canada. However, while other jurisdictions in the world have made use of such solutions, to date, no jurisdiction in Canada has done so. Ottawa Public Health has been in regular contact with the Ontario Ministry of Health about our needs to automate aspects of contact tracing, but we're not aware of any plans by the province to develop or adopt a contact tracing application. Similarly, we're not aware that the federal government has any such plans. But should that change, either the federal or provincial governments proceed with making a contact tracing application available, we would consider aligning with that solution or ensuring that our application will be able to communicate with others. So the developers of such solutions need to partner with a recognized public health agency to make the applications useful and available to the public. And Ottawa Public Health is looking to partner with a developer to finalize and customize a contact tracing application to make it available to the public. And the use of the contact tracing application would be on an opt-in basis. It would be voluntary. And safeguards will be put in place to protect personal information, which would only be used by Ottawa Public Health to identify close contacts of infected individuals and notify them of the appropriate actions to take. Further, Ottawa Public Health would only access this information with the explicit consent of the infected individual. Given this is a new technology, it's not being used yet in other Canadian jurisdictions, there's a motion for the Board of Health to consider tonight to lend support to this direction. Étant donné qu'il s'agit d'une nouvelle technologie qui n'est pas encore utilisée par d'autres juridictions canadiennes, et envisage d'apporter son soutien à cette orientation. So going on to slide 6. Because the number of laboratory confirmed cases will likely keep increasing as we increase testing, I prefer to look at hospitalizations to get a picture about the overall trends of infection in our community. And that's what's depicted on this slide. Hospitalizations in the lighter blue and intensive care unit admissions in the dark blue. And that's the date along the bottom. So while there is a lag between when someone's infected and when they develop severe enough infection to be hospitalized, it's less likely that these severe infections are missed or not counted compared to the mild infections in the community that people manage at home. So as of 4 p.m. yesterday, April 19th, there are currently 37 individuals in the hospital and 10 people in intensive care due to COVID-19. And the graph of hospitalizations shows that the number of hospitalizations has been stable over the last week, possibly a decline. And we'll see that a decline in these hospitalizations would likely reflect a decline in infections in the community the week before. So on slide 7, we are a part of the health system more broadly, and the healthcare system response is part of what we're contributing to. We have helped with the establishment of different healthcare services like the assessment center and care clinics. We know that the hospitals continue to be focused on making sure they have the surge capacity needed if infection rates were to rise. I do have more information about the number of patients being seen at the Heron Road Clinic, 260 in the first 6 days of operations, and the Moody Drive Clinic has seen over 650 since opening on April 6th. These care clinics help deflect people from emergency departments and primary care settings with diagnostics on site, and they're integrated with hospital health records for continuity of care. And a service of interest to the board, I believe there were questions previously about the community paramedicine program that is now active, providing outreach to long-term care homes and leveraging general practitioner labor pool to create a home visit kind of model to help community paramedicine activities and complement the care at home. This is being ramped up through mobile outreach teams that are going to include retirement homes and also other populations with barriers such as homeless or women's shelters, family shelters. The service includes testing, and it also allows people to access personal protective equipment and other things that they need. The question from the board previously was whether this service is serving rural Ottawa, and that is the case. Let's take a sip of water. Thank you. So the last point on this slide is also key. PPE, short for personal protective equipment, is one of the key resources that we need to have in better supply before we can look at easing up on restrictions, overwhelm our healthcare system. We are still having to work hard to make sure that that supply is stable into the future, and people continue to promote COVID donations at toh.ca as an email address that people can use if they have a supply to donate as medical personal protective equipment. On slide 8, the Premier and the Minister of Health today spoke about the Provincial Action Plan for Long-Term Care, and I can tell you that we treat retirement homes the same as long-term care homes in Ottawa, that this is a top priority for the province and for us locally in the health system. They have had 24 outbreaks in institutions within Ottawa, and 16 deaths have been associated with these outbreaks. 5 outbreaks have been resolved, and then 19 are ongoing. So all the long-term care facilities and seniors residents in the City of Ottawa have regular communications and guidance from Ottawa Public Health's Infection Prevention and Control team, and we are working with the healthcare sector to allow streamlined and coordinated access to some of the new supports available, like staffing and rapid access to personal protective equipment. There are new provincial testing guidelines that mean that homes are now expanding testing to those who have previously maybe had atypical symptoms, or in settings of outbreak, they are now testing asymptomatic residents and healthcare workers. And also anyone who's been admitted to a home will be tested regardless of symptoms. Do you want to take a moment to explain, because I'm getting a lot of questions about testing in long-term care homes and retirement homes, that testing in itself is not the solution to decreasing COVID-19 transmission in institutions that have outbreaks, because a negative test does not rule out that a person is infected. They could be incubating, and it could be a falsely reassuring negative result. Tests early in the infection can be falsely negative if the viral load is low. And so a reliance on the testing, you'd have to keep testing over and over again to see if those negative people continue to be negative. What's most important is having good infection prevention and control practices in place, the personal protective equipment that breaks the transmission of the virus. Universal masking in particular is a very important practice to reduce transmission from a person who's infected but does not yet have any symptoms. So these are the kinds of things that we're helping the homes with. They also need to access eye protection and gloves and gowns. beyond long-term care homes and retirement homes, we're also working with priority populations in other congregate settings. So we've created guidance for shelters, homeless shelters, for violence against women shelters, youth group homes, working with the Children's Aid Society, rooming shelters, domestic hostels and hospices. And when there's a positive case of COVID in a congregate living setting, our infection prevention and control staff respond with the same kind of response that they do for a long-term care home or an outbreak. So they make sure that all the infection prevention and control measures are in place, that those who need to be tested are followed up with. And we do work in partnership with the city's housing staff if it's needed to be able to increase the ability for people to socially distance or self-isolate. There are other supports provided through the Human Needs Task Force, like food, if people are not able to be housed where there is a cooking facility. So I'm going to move on to the next slide 9, which is interventions. So here, this is where it's getting hard to maintain, but it's been so successful. We saw the slides at the provincial level today that we could have been the worst case scenario, and we're tracking on the best case scenario due to all the work of people practicing the 2-meter rule of staying 2 meters away from others, making sure that we decrease that chance for transmission. So I do want to say that the modeling shows that this is an effective measure, but the modeling hasn't been able to incorporate everything. It's not, for instance, including variables like the use of masks. And so I want to spend a little bit more time talking about that tonight. That the use of masks when outside the home and close to others in indoor settings can play an important role in reducing transmission of COVID-19. So probably the most effective strategy is a combination of some physical distancing and mask use. It's been shown that physical distancing protects our ICU capacity, and we've been successful at that, but we still need it to protect the older adults and the more vulnerable populations that are in institutions and congregate care settings where we have not made it through the peak of illness. The more effective—
Susan Ward.
All right. So these practices are hard to sustain. Everyone wants to know when we'll be able to relax them, and I'll speak about that in a moment. But in the meantime, we're facilitating significant public engagement campaigns to support physical distancing, and people continue to have questions about how best to protect themselves and others with public health measures. So we're continuously adapting our messages to different audiences and more targeted audiences. So we're continuing to ask people to limit trips outside their home to essential needs such as groceries, medicine, or daily physical activity, and to limit close contact to members of their household, and always to practice hand washing and coughing and sneezing etiquette. Homemade masks. Homemade masks. Oh, I'm getting some. Oh, sorry. Homemade masks or face coverings are one non-pharmaceutical intervention that we know is useful because there's asymptomatic or pre-symptomatic transmission of COVID-19 in the 48 hours before people feel unwell and they would know to self-isolate. There's two different things there. An asymptomatic person can transmit the infection and never become ill. A pre-symptomatic person will become ill but won't know to self-isolate until they're feeling ill, and it's that 2 days before they feel ill where there can be transmission. And the models are showing us that these two things may be important drivers of our pandemic. And so until hopefully a vaccine becomes available to control the spread of the virus, we do see that masks can play an important role in slowing the spread of infection. So if you are ill or you need to be wearing a mask when you go out to protect others from your respiratory secretions and prevent the spread. And At the same time, we're facing a worldwide challenge with securing enough medical masks for our healthcare workers and first responders. So Ottawa Public Health is avoiding promotion of medical masks for the general public. We need to secure that supply for our healthcare workers. And the healthcare sector, supported by the Provincial Ministry of Health, is working hard to increase supplies of medical masks for healthcare workers. What OPH is recommending is non-medical or homemade masks, face coverings, when physical distancing is not possible, such as in grocery stores or in public transit. And we've heard that access to these non-medical masks is a challenge for people in Ottawa. And so there's a motion before you for the board to support the direction of pursuing options for increasing the production and supply of homemade masks or face coverings to enable everyone in Ottawa to wear a non-medical mask if they wish to follow our recommendation to add this layer of COVID-19. On slide 10, there are a number of priority populations that I could mention in terms of the more targeted messaging that's required. We have a website that now has critical information in over 30 languages, targeted messaging for seniors, parents, youth. We have a priority population engagement strategy that is looking to continue to try to better understand the needs of a variety of communities in Ottawa. So our mental health team is working closely with partners to develop guidance for coping with the current situation, including speaking to children and youth about the pandemic, a guide for employers about how to support employees' mental health, and a series of tools. So one population that's been partnering is the Indigenous Health Liaison with the Ottawa Newcomer Health Centre to adapt messages on mental health and coping for newcomer and different communities that the Newcomer Health Centre serves. Since the onset of the pandemic, the Ottawa Public Health Indigenous Health Liaison has been responding to a variety of health requests and working with community partners to find solutions. This is in addition to the Human Needs Task Force work. The Ottawa Aboriginal Coalition and local Indigenous partners have identified that there are COVID-19 specific needs and barriers for First Nations, Inuit, and Métis people in Ottawa. For example, there's a need for collaborative case management and access to testing with Indigenous primary care providers. So Ottawa Public Health is listening to our Indigenous partners to understand the community's needs and information needs, as well as the most effective ways to reach community members using different communication channels and networks. We've been working with partners to gather and share First Nations, Inuit, and Métis specific COVID-19 information and resources, including the mental health supports. And there's funding available for Indigenous-led COVID-19 initiatives, and we're offering to partner and support proposal applications as needed. We've been providing support to African, Caribbean, and Black populations as well as immigrants, refugees, and minority populations through partnership with Somerset West Community Health Centre, Refugee 613, Ottawa Local Immigration Partnership, and staff from Councillor King's office in order to assist with a series of Facebook Live events related to COVID-19, mental health, enforcement, and violence against women. There's a Facebook Live event for Arabic communities that is being planned on mental health and COVID-19, and collaboration with the Somali Center for Family Services is also being scoped out. So there are a variety of communications being leveraged, such as the Chin radio campaign and the development of videos in Arabic, Somali, and Mandarin to help clarify physical distancing, physical isolation, mask use, etc. We're also looking at developing more information around multi-generational households and how to handle self-isolation. So we're serving individuals with developmental disabilities by providing assistance to members of the Ottawa Development Services Network. And Ottawa Public Health is providing guidance on questions related to health, resources for staff, access to PPE, and also working to increase access to testing for people who may have difficulty getting to centers. We'll continue to support the Human Needs Task Force in their outreach to rural communities, and we'll also be looking to partner with them to understand what counselors are finding the needs are in their wards. We've been assisting older adults by providing information specific to the older adult population on our website, and we have reached out to other organizations that can better determine the needs of older adults. So thank you for bearing with me. There are a few more updates on this slide. I'm going to turn to make people aware that we continue to make it easier to find the mental health resources on our website. There's now a mental health and COVID-19 banner on our main coronavirus webpage, and I recommend that people continue to check back. So we know that for some, home is not a safe place, and this is why we are partnering with Crime Prevention Ottawa, the Ottawa Coalition to End Violence Against Women, Interval House of Ottawa, and the Eastern Ottawa Resource Centre to launch and share a new initiative called Unsafe at Home. It's a text and online chat tool that allows victims and survivors of domestic violence and abuse to get help. It was created because it may be difficult or impossible to reach out to a crisis line when trapped at home, and we know that this is a challenge that we want to address. And it's hard to talk about, but we know we want to protect children as well. Ottawa Public Health partnering with CHEO, the Children's Aid Society, and Ottawa Police Services in development of a daily child and youth protection meeting that addresses complex cases in the context of COVID-19. We have a joint communication working group developing strategies to promote reporting and communication to families and children. And we're working with the 4 school boards. We meet with all the school boards weekly, and we're using that venue to reach out to families who might not have been in touch with their teachers or their principals or their school board. The teachers have a unique window into homes through online education, and they're being provided tips and tools to be able to identify concerns that could be arising. And then Ottawa Public Health is looking to connect with families through the Human Needs Task Force that has the capacity to do wellness checks, in addition to the work that the Children's Aid Society continues to undertake with their existing clients. For rural communities, the Canadian Red Cross is doing more wellness checks, and Ottawa Public Health is currently working to make sure they have all the right precautions, necessary PPE, to be able to send volunteers in to do quick checks and identify needs. So together, we're all working on different pathways to support families that might be facing barriers. 2 more things before leaving this slide. One is to say that Canadians are reporting an increase in alcohol use, particularly people under the age of 54. There was a poll recently commissioned by the Canadian Centre on Substance Use and Addiction that found 25% of Canadians aged 35 to 54 have increased the amount of alcohol they drink while spending time at home, 21% increase. And the main reasons given for this increase were a change of schedule, boredom, and stress. And certainly staying home is important, but it is a stressful time. People have different ways of coping with stress and isolation. So as always, we're looking to promote moderation as key. Ottawa Public Health is urging people to monitor their substance intake, including alcohol and cannabis, to know their limits and to pace themselves, and to find other ways and other means of coping with stress and isolation, including reaching out for support. There are many resources available for those who need assistance with substance use. One of them online is Breaking Free Online. It's an evidence-based support program. And again, our mental health webpage lists others. So lastly, board members will be aware that on March 30th, the Government of Ontario issued an emergency order that effectively ordered the closure of all outdoor recreational amenities in Ontario. That was parks, but it also specified that it included all outdoor allotment gardens and community gardens. And this has been flagged as a concern because in addition to providing a source of outdoor physical activity, community gardens also represent an important measure for increasing food security for many residents. So we further believe that with proper public health guidelines such as physical distancing and scheduling approaches to avoid crowding, community gardens could operate safely. So for these reasons, Ottawa Public Health is recommending a motion that the province consider amending the March 30th emergency order to exempt outdoor allotment gardens and community gardens where food is grown. On to the final. I want to just say the obvious, which is that all of these activities mentioned above take financial resources to carry out. And so currently, Ottawa Public Health is exceeding its budget by approximately $750,000 per month, with most of this added cost due to employee compensation for additional casual and temporary employees added to the team and for overtime hours, which we are working hard to reduce. This figure also includes loss of revenue and savings that we're able to make as a result of program modifications. So we're monitoring our financial figures, we're keeping track of all our COVID-19 specific costs, and this amount of spending per month is subject to change based on how the response evolves. The province has announced funding, including $1 billion for contingency and emerging needs, as well as $160 million for monitoring, surveillance, testing, and virtual care. And we've asked for more details from the Ministry of Health and learned today that the financial support approved specifically for public health units and Public Health Ontario, which is doing a lot of the testing, is $100 million of that 160, and that would be for extraordinary costs incurred. Slide 12. We're focused on the health of employees, and especially employee safety. We've implemented measures to keep employees safe in workplaces, including our own workplace. And these measures are aligned with the latest guidance from the Ministry of Health and Long-Term Care, the Ministry of Labour, Training and Skills Development, and the Public Health Agency of Canada. And we continue to look at these measures and continually improve and adjust as new guidelines evolve or employees raise ideas. I want to say that we've prioritized safety, but we're not quite at the stage, I don't think, I can leave it to the team to weigh in on really actually being able to also consider promotion of well-being. We've been promoting mental health, and we've been working hard on sustainable schedules so that everyone gets a break. We've been promoting things like mindful walking, but we're not there yet in terms of, I think, everyone having a sense of well-being. So that continues then to be our goal. So as we look ahead, the question on everyone's minds, how much longer will this current situation continue? Restrictions. What data are you going to use to decide? These are questions that we need to look at collectively at the federal, provincial, and local level. But to begin with, it must be clear that the current epidemic here in Ottawa still has lots of room to grow if strong control measures are not in place. Our current tests can only tell if someone's currently infected, and we're not able to test a whole portion of the population, so we don't really know how many people in Ottawa have been infected. There are estimates that perhaps somewhere around 1% of the population has been infected, but that leaves 99% of our population not yet immune to COVID-19. So that means that any illness could quickly multiply if interventions like physical distancing and masking aren't in place. So this situation would continue until, perhaps hopefully a vaccine is available, And so we need to think about how we relax restrictions carefully and safely. So in addition to being able to test to detect the virus as is happening now, an important addition would be a surveillance system that looks at the blood serum to test for antibodies against COVID-19, and that would show whether someone's been infected or not, and likely if they've been infected, is immune, although data about lasting immunity is lacking. So the province is working on this surveillance system that will include using these serology tests to measure antibodies to COVID-19. And I want to take a moment to speak about the different COVID-19 tests that could be available and how they might be used differently. I think it maybe hasn't been spelled out exactly, but the goals of testing for COVID-19 change over the course of a pandemic. To begin with, the tests that we first used and we're continuing to use are for diagnosing someone with the infection. The test actually detects the COVID virus. And initially, we focused on testing travelers to try to detect early cases and then limit the introduction of the virus and the spread of the virus. Then we added a focus on identifying the virus in high-risk settings for workers, like healthcare workers, essential workers, who need to be able to work. And we rely on self-isolation and physical distancing to keep people who might have COVID-19 infections in the general population from passing them on without the need for a diagnosis. So ideally, we'll keep increasing testing capacity to be able to find COVID-19 cases in the general population, so our case and contact management can be as effective as it can be. And then keeping the rate of transmission as low as possible in the general population may help us let up on some of the closure and stay-at-home restrictions. So still looking to maintain that physical distance, that 2-meter rule as much as possible, and likely perhaps adding the wearing of masks when close to others in indoor settings outside the home. So as mentioned, the next type of test to be available is the serology test. It'll be useful not so much for diagnosis, but it will help us understand what proportion of the population's been infected. Serology tests are not as good for diagnosis because it takes a few days to a week for those antibody levels to become detectable. And so that virus detection test will show us that someone's infected sooner rather than the serology. And so when people speak about point of care tests or rapid COVID-19 tests, they're often referring to the serology tests. And there are some, though, that are looking at being able to detect the virus. They're in development. And none of these tests are available in Ontario yet, to the point of being a useful intervention tool. Most of them still need to be validated. And in some countries, people have had to cancel their rapid COVID testing programs because the rate of false negatives was too high. So in terms of how to go about this relaxing of restrictions, the World Health Organization just shared their recommendations in terms of 6 criteria that jurisdictions should have in place before lifting restrictions. Firstly, that disease transmission's under control. Secondly, that health systems are able to detect, isolate, test and isolate, treat every case and every contact. That hotspot risks are minimized in vulnerable places, such as nursing homes, long-term care facilities, retirement homes, and group homes. And that schools, workplaces, and other essential places have established preventive measures. And that the risk of importing new cases can be managed. And that communities are fully educated, engaged, and empowered to live under a new normal. And so locally, we're looking at the data, we're monitoring for a sustained reduction in the number of cases hospitalized and in intensive care units over a 14-day period. We want to ensure that we have that stable hospital capacity, strong testing and case contact management, and supports for those who will continue to be disproportionately affected, such as people in congregate care settings, in retirement homes, long-term care homes, shelters. And the relaxation of restrictions will be related to closures and the stay-home requirements, but I want to signal not giving up on the idea of the 2-meter rule as a useful protection. We need to be gradual, and we need to work with our government at the provincial and federal level, as well as neighboring jurisdictions. The use of masks outside the home will likely be an important adjunct to the relaxation of restrictions. In line with Ottawa Public Health's commitments in our strategy for Ottawa Public Health, community engagement on the priorities and the process for these changes is important. And so Ottawa Public Health is working with the City of Ottawa on a public engagement plan. So that's it for all my COVID work. Much longer. I'm mentioning we're actually involved in the city's flooding response as well. We're a liaison member on the Emergency Operations Center's Spring Freshet Incident Management Support Team. All of our flooding messages are up to date, and we've been using a COVID-19 lens on that. And so we're in situational awareness right now, and we're prepared for an enhanced response if needed. So if required, our main role is going to be to support communications, provide infection prevention and control consults, and link residents and partners with resources. So residents can still submit well water samples for testing at locations in rural Ottawa, and there's information on our website about water bottle pickup and drop-off locations. So in closing, I want to thank everyone on the board, anyone listening, so many members of our community that have been dedicated to supporting others in the face of a pandemic. I want to thank residents for their collaboration in practicing physical distancing and for finding new and innovative ways to support each other, providing donations, making homemade masks. This is very important work that we encourage volunteers to continue. I want to thank the Registered Nurses Association of Ontario, RNAO, for the support during this crisis to significantly enhance our capacity with over 100 nurses for triaging, test results, case management, and contact tracing. And I want to thank our city partners. Our city departments have been supporting our efforts in various ways, including redeployment of resources to Ottawa Public Health. I have a little statistic here that might be interesting. Of all the employees working for Ottawa Public Health on COVID-19, 31% are redeployed from the City of Ottawa. And so right now, I do want to also thank our healthcare system partners for their efforts to increase capacity, share resources, facilitate patient flow, and so many other ways that they've been stepping up to support people who are ill. Lastly, I want to thank the media for their continued work in ensuring that residents have accurate and timely information. Their role is also essential. Merci beaucoup. Je suis ici pour les questions. J'espère que quelqu'un est là.
Yes, we're here, Dr. Etches. We're here. It doesn't matter how many meetings I take part in, this darn mute button. So I will run through to see if anybody has any questions for Dr. Etches, starting with Member Banham.
Hi there. Thank you, Dr. Etches, for that update. I really do feel like it was very fulsome. I don't have much to add. My one question is about the new symptoms. It does feel like everything is a symptom of COVID-19 now. Can you explain more about when people should get tested? Like if somebody has one mild symptom, should they be going to get tested, or should they really be thinking about who they've been exposed to before making that decision?
The atypical symptoms are more commonly found in older adults, and so that is more where those symptoms would prompt testing for COVID-19. You can always check in with your healthcare provider over the phone if you have questions about whether it applies to you. If there are nausea and vomiting or diarrhea, you know, and you have clearly a gastrointestinal outbreak happening in your home or something, you know, there could be other reasons for these illnesses. So you need to look at the whole picture of what's happening. But yes, when we're trying to be sensitive and catch all cases, and then that may be something where we end up doing more testing in these other less typical cases.
Thank you. I appreciate that. I just want to say thank you to all the public health staff who have been doing such an amazing job. I definitely have fatigue being 2 weeks postpartum myself, and I received my public health call and want to thank those workers for continuing to do the amazing work that they do. So that's it for my questions over here.
Thank you, Member Banham, and a big congratulations to you as well. Member Kluche.
Thank you, Chair Eglai. Member Banham, congratulations. I didn't know that the wonderful event had occurred. Congratulations. Dr. Etches, thank you very much for your report. Thank you for your leadership. And thank you to all the staff at OPH who are guiding us, for assisting the residents of the City of Ottawa through through the pandemic. A couple of questions, please. You spoke about face masks and not promoting, but recognizing the use of non-medical face masks. And I absolutely understand that we don't want public who might not be symptomatic, might not require one, that we certainly don't want people using medical grade face masks. Can you speak of the false sense of security and the risk associated? What will the risk associated be with persons who are wearing face masks who might not respect the 2-meter physical distancing guidelines, who might, with a sniffle or a cough, choose to go out because they have a face mask, even though it's non-medical? Are these other measures not the most important measures with respect to reducing the propagation of the virus, and how will we message that?
Yes, I agree with you that physical distancing and staying home when you're sick and washing your hands and coughing into your sleep, all these things are much more important to have in place first, and then to consider, and I do recommend the use of a mask if people are going out and they can't maintain that physical distancing. The way Ottawa Public Health is planning to continue to raise more awareness about non-medical masks and face coverings is through more targeted messaging on this subject. We've created a mask webpage and different resources that will talk about how they're not perfect in terms of preventing all of your respiratory secretions necessarily from escaping, and also that you need to use them properly. So I think it's a new thing for most people in our community to be trying to wear a face mask when out, and it's not an easy thing to do. So I think that we need to continue to help people understand how to wear a mask safely without causing more contamination, and we'll do that on various channels.
Thank you, Dr. Etches. A few more questions. With respect to community gardens, Chair, the motion has not been introduced. Would you like me to wait until the motion is introduced, or can I ask a small question now?
Either or. I mean, it may make sense to wait until we introduce the motion. Then when we can sort of, everybody who has questions around the gardens can ask them at the same time, and we won't lose the thread, I guess.
Very well. 100%, I will do that. Thank you. Just one question. You talked about the budgetary pressures and the work that OPH is doing, and the increased expenses. And as an accountant, I absolutely understand that. Can you speak to the level of confidence to which you believe that will be recoverable from another level of government, from either the province or the federal government? Is it your expectation that those amounts will be recoverable?
I can't speak for the provincial government, but the provincial government is our likely source. I can't think of a precedent yet, but this is unprecedented territory when the federal government's given funding to local public health units for their usual kinds of operations. With H1N1, with flooding, with large infection and control lapses, the province has stepped in to cover extraordinary costs. And this is the language they used again, that there would be support for extraordinary costs. I can't say that it would cover 100% yet. I'm not sure. So we're seeking that clarity.
Thank you very much. And again, thank you for your report and thank you for your leadership. Thank you, Chair. That's all for now.
Thank you. I'm going to raise an issue, interrupt here for a minute, but I suspect we are going to go past 7 o'clock. So I'm going to ask our secretary to, while we go through the next member with questions, if she could please forward a copy of the appropriate motion to Member Menard, and he can read it in, and we can deal with that after the next speaker, please. And the next speaker would be our Vice Chair. If you have any questions or comments.
No questions, just to echo, I think, what every citizen in Ottawa is thinking in terms of our appreciation for all the efforts of particularly Dr. Etches, but also every staff member of Ottawa Public Health. And I guess just to add, as a board member, incredibly proud of the response and the respect for OPH and how that's translated into the community. So nothing further from me.
Thank you very much for those very kind words for OPH. Member Menard, do you have the motion? Are you in a position to, could you do that, please?
Yes, Chair, that's fine. So, il est résolu que le Conseil de santé approuve la prolongation de la réunion au-delà de 19 heures, conformément à l'alinéa 8.1c du règlement de procédure.
Thank you very much. Carried?
Adopted, yes.
Yes.
Carried.
Okay. No dissent? Okay, thank you. Member El Shantiri.
I'd just like to echo my colleagues' our appreciation to Dr. Etches and her team. And I also want to thank you for supporting the remote testing. And I know it's been championed by you, but I see the paramedicine are taken on in the remote area, and thank you for this, and thanks for your staff supporting us on the flood. The question about the funding, the city is keeping tab on all the additional costs from COVID-19, and I would imagine the public health will be doing the same. Is that correct?
That's correct. As I say, most of it is staffing costs, but if there are any supply costs or others, those are all being tracked. We've had to look at different technology solutions. All of that will be part of the costing.
Okay, thank you. That's my question. Thank you, Mr. Chair.
Thank you. Member Gower, please.
Thank you, Mr. Chair. My question for Dr. Etches is, you touched on mental health in the community, you touched on substance abuse and alcohol. How does Ottawa Public Health actually measure or monitor the overall public health in the community? What kind of data or information do you have access to have a good sense of how the community is coping?
So this is where I turn to our epidemiology team, led by Amira Ali, who has been added to her team, leading surveillance. Besides measuring all the things we do related to the infection, we are also looking at indicators of health in our community. And I don't think they're all necessarily, the full framework of our surveillance system isn't finished. We're continuing to add to that picture, but we can always look at hospital visits, the use of different services like calls to the distress center, what's being used, as we promote the services, what people are taking up. We get a lot of qualitative information as well, from our different contacts in the community and what people write to us. So we do hear that people are finding this a hard time, and we're looking to be able to continue to monitor that and hopefully see an improvement over time as we're able to make some changes and restrictions. But we're not there yet, and we'll keep an eye on it.
Okay, thank you very much.
Is there anyone else on the Ottawa Public Health team who wants to add anything about our surveillance for mental health at this point? No?
Just one thing, Vera, it's Andrew here. Andrew here. So just one of the things that we're doing is we're also partnering with several stakeholders with respect to surveillance measures and specific to mental health. We are working with the Royal Ottawa in a partnership with them to get a better assessment and better data on that issue.
Thank you, Andrew. Are there any other questions, Member Gower?
No, thank you.
Okay, thank you. Member Kavanagh, please.
Thank you very much. There's a couple of things that I'd like to specifically thank you for, and that is on the emphasis on domestic violence and the concern there. Given the prolonged period of time that people are staying at home, this is going to be a risk, and I want to thank you for recognizing that, because this is extremely important, and we need those resources to deal with it. Is there any specific resources being put for this?
Well, we have dedicated liaison people working with the sector. As I mentioned, some of the work has been to promote resources that have been created, and then it is part of what we're looking at also in our surveillance system. We have the team that's working on child protection issues as well. So there are dedicated liaison people and teams underneath each of the priority populations.
Thank you. I also want to thank you. I want to thank you for the clarification on physical distancing for neighbors. I know that this is an issue that was not clear, and I appreciate your clarification, because we've had another number of communities that still want to reach out to each other, but keep that social distance and keep the numbers below 5. And that was very helpful to have that clarification, because I think that's part of mental health, is people
Susan sharing
each other. Sorry, that was very. Oh, okay. Somebody was on the line. So I appreciate the clarification. It is one of the biggest concerns I hear about, is the concern for people being able to get out, and also to get physical activity in terms of getting out, and for those that who don't live in places where they have backyards, etc. That's been an ongoing problem that we've had in communities where people live in apartments in small areas. So if there's any possibility of having restrictions that are based on physical distancing that could help out that community, they'd be very appreciated.
Dr. Etches, are you?
I agree. I don't.
That, or?
I think the board will have some more conversation. I agree. People need activity, space to be out, to get out, and that's something we've been promoting, that people can go out and walk. I've always maintained it's important to keep our parks open for walking through. Although it's a provincial order that the parks are closed, everything in the park is closed under a provincial emergency order. I really support the city's work to enable people to walk through. I think these kinds of things are important.
Okay, thank you. I think we may have to look at other options too for those that want to keep active beyond that. Okay, thank you.
Thank you. And Member Lakin, please.
Thank you, Chair. Firstly, I just want to express the same gratitude that everyone around the table, in fact, the entire city feels, that we owe a tremendous debt of gratitude to Dr. Retches, to the chair, to the entire team at OPH for keeping us safe and digging deep behind the scenes that most of us don't even recognize or see. And so thank you on behalf of all of us. The question I have is just a short one, which relates to something Dr. Retches talked about looking ahead and relaxing restrictions. From what I understand, Ottawa has been pretty compliant with physical distancing so far. As we stretch into nice weather, it gets longer. My question has to do with how specific does the messaging get, and how much information do we as a community benefit from in knowing what it's going to take to relax some of those restrictions? So what I'm getting at is, do we get a goal as a city that says once we get these number of hospitalizations and these number of ICUs, we can start to relax in order to keep our compliance high and achieve the compliance that you're looking for? I don't know if that's clear, but that was what I'm wondering about as we try to look ahead.
Yeah, I think there are a lot of aspects to your question. The first one, maybe I'll tackle is the idea of triggers. So we reached this number of hospitalizations, declined for 2 weeks. Great, that incubation period, 2 weeks, and we're still not seeing a rise. Those kinds of things will definitely be very reassuring. I just can't set those right now without some guidance from our Chief Medical Officer of Health to make sure that we're looking at this collectively, because what one part of the province does affects other parts of the province. And I think it's going to be collective. It's not going to be one measure. It's going to have to be that decline and the readiness measures, looking at long-term care. I think really making sure that we have all the protection we continue to add and signs that that's slowing the rate of infection in long-term care and retirement homes, I think is probably also really important provincially. But I think the other part of your question is about reasonableness. And I've heard that loud and clear, that one of the things that will help people the most is being able to be active outside. People have said, can you just let me, play on a field with my family again? These things are extremely important. And so I think what I can do is collect this information from our community and feed that back up to the province so that when they're making their guidelines and they're thinking about what to relax first, that they have that information about what's important to the public in terms of being able to relax restrictions. There are some very, very creative ideas that people are sending to me, which are really worth considering. So, we want to maintain physical distancing, but there's a middle ground. Say, for instance, one family that's been trying to maintain their isolation in their household for this long period of time, and recognizing it would make a huge difference if they could just have one other family as part of their household bubble. And so having like a pandemic buddy, an older adult who is isolated on her own and said, I just want one person that I can meet with. Well, that sounds reasonable to me. These are reasonable things that would slowly increase the number of contacts people have without opening it up entirely. So these are the kinds of things that we need to think about. And so when it comes to physical activity, the same thing. Somebody wants to go running with a friend. well, maybe you just choose that one friend, and that's your one person that you now have a little bit more contact with, but you don't join a group of 30 again, like you maybe did before. And so there's staged ways that we can go about this and practical recommendations we can make that would slow down the number of people just going right out there and causing a lot of transmission, but would be easier to maintain than what we're doing now. So I'm open to all of those things. But I need to work with others. I'm not the sole decision maker here, and I appreciate the input that I'm getting.
Any other questions, Member Lakin?
No, thank you. That was very thoughtful.
Thank you. Member Menard, please.
Thank you very much, Chair. And I as well want to thank you, Dr. Etches, for your leadership, as well as your entire team. People like Ashley Brambles have been excellent in just coordinating with me constantly on all kinds of issues and up late at night and over the weekend. So I know how hard it has been on OPH staff and what a fantastic job everyone has been doing, not just on the regular working hours. I have a question. I've been getting a lot of emails and inquiries from people around our parks in particular, and one of the things that keeps being raised is that we have a lot of people, immigrant families, people who are living in apartments with little access to private green space, if at all, as well as the kids in those apartments. And so, you know, we had that story about the Capitol Towers building off of Donald Street, and many of those families include Syrian refugees with young children, and difficult in terms of staying the course on this. My question, I guess, is, are we distributing information in different languages to those apartment buildings specifically, where English may not be their first language? And the second question is around a harm reduction approach to easing out of the strict measures we've seen in the open spaces in our parks. I'm not talking about the basketball areas or like the playground equipment, but the open field spaces. Those are the two inquiries for myself.
Member Menard, I'm going to start, and then I'll let Dr. Etches jump in. So certainly some of the things that we've done and we've been working on are, we just launched a page on the website with messaging, I think in 20 or 30 different languages available. We also are working with Refugee 613 and their partners to pump out the information that we get, and so they can then put it through their channels of communication and social media channels to reach a wider audience there. We have supported Facebook Live events, most recently with the Arabic community. We've helped to support that to get the message out. I believe, and Dr. Etches may be able to clarify this more, but I believe that there's also a movement at the city for the public sort of park signage to, since there are so many languages, to move towards more of a graphic message as opposed to a written message, so we can reach a larger audience. So there are quite a number of things going on. I may have missed some, and I'll turn it over to Dr. Etches, but we're well aware of that, those concerns, and we're trying to work with various, as I say, stakeholder groups throughout the community in the city to help us get that message out to the more diverse populations. And I'll just turn it over to Dr. Etches.
Sure. On the harm reduction approach to open spaces, I'm very sympathetic to that priority. I think, as I said to Member Lakin, I think this is something we have to advance to the province, because right now it's illegal under the emergency order. That order goes until March 14th, I believe, or March 12th. And so, you know, we need to prepare to have a considered conversation about a different way in the near future. Andrew, I'm going to ask Andrew. Andrew's been leading our incident management response and the COVID response entirely internally to OPH and has the latest on work in different languages and with different communities. Did you want to say more about the families and,
sure.
Yeah, okay.
Yep, absolutely. Thanks, Vera, and thanks, Chair. Yeah, so the Chair, you're correct that we have increased in the last few days the number of languages in which we're providing some of our key messages. We're up to 30 different languages that we're using to reach a broader audience. One of the key partnerships that I would that I'd like to mention is the importance of the Human Needs Task Force. So this is a city-led task force, and it really relies on the broader network that the City of Ottawa has in terms of connecting with these priority populations. So in the specific situation that you spoke about, Councillor Menard, we did work closely with the Human Needs Task Force to make sure that that population, that building in particular, receives some targeted messaging and supports. But the Human Needs Task Force is our go-to partner for these types of items, and it's about packaging our public health messaging in different ways for different populations. And so we have done that. The other thing that we've done just in the last couple of days was we launched a website to help residents provide feedback to us, specifically on parks, but how to stay active during the COVID-19 response. So wanting to hear from people what access points they need, speaks to Vera's earlier points about relaxing some of these restrictions that are in place, but that's part of the conversation as well. And specifically on parks, I can tell you that we're working closely with our Rex Culture and Facilities partners. Definitely there. So one of the other task force, there's lots of task force lately, but that was the Stripe put up was a parks task force. Just especially in the early days, there was still some confusion around parks and who can go to the parks and what does that look like. And so that's a strong partnership that we have with Parks, Rec and Culture about getting specific messaging up into the community and specifically to different priority populations.
Great. Thank you so much for that response. It's great to hear that, and I know a lot of work has been going on to translate into different languages, and I just hope we're reaching out to those buildings specifically as much as we can proactively. I know we've been doing a lot of that work. I will have a motion later on under this item, but for now, that's all my questions on the report. Thanks, Chair.
Thank you. Member Pinnell, please.
Merci. Merci, Dr. Etches, pour votre présentation et merci pour votre dévouement, je dirais, inlassable pour le bien-être de toute notre communauté. Also, in the same vein, thank you so much for the amazing work that the public health workers, all your team are doing. Now, I do have a question. You were mentioning about the blood test for antibodies. Is it really upcoming, like in, let's say, in a short period and not too long? Because it would be sort of so great to know that, yes, we've had the disease, even if we'd had not too many symptoms, and we've survived, and now we can build an immunity. So do you know if it's upcoming?
So I've had some conversations with my provincial colleagues to try to better understand the testing strategy going forward. And I think we don't have a formal communication yet, but my understanding is that the serology will be used within the next couple of weeks to get the surveillance picture. So the first way I think that it'll be used is to try to get a measure of how much of our population is immune. Wow. And so yes, I think last week, or I spoke to someone who said it could be 3 to 4 weeks away.
Oh, that's great, because it could be added even to a CBC, a complete blood count, whenever we go, like whenever anybody goes for a medical appointment or something. So yeah, thank you so very much.
There's a lot we need to learn about how it's best used, but it is, it's definitely of high interest.
Thank you. Merci.
Thank you. And Member Tilley, please.
Yeah, so Dr. Etches, I just wanted to first echo everyone else's words on the incredible job yourself and the entire team at Ottawa Public Health for stepping up to, I guess, deal with this unprecedented and certainly unplanned, unpredicted, unexpected crisis situation, but also for dealing with those things out of your control, so that you had no control over, such as the shortage of medical supplies, sometimes the misinformation and that, and to yourself as well too for the lead you've taken on dealing with the media. Congratulations. I just had a question then, and perhaps more the medical professionals already know this. Speaking of misinformation, we sometimes hear talk now of these different strains of the virus, and I just wanted to get your thoughts on that, if that is so, because we hear of some people with flu-like symptoms, and people have tested positive, and that's as far as it goes, and then others are brought to near death. Is it your estimation that that's a result of different strains of a virus? Could it be people's relative immune systems, or what are your thoughts on that so far, Dr. Etches, or is it too early to tell right now?
Viruses do change over time, and that's something people can measure when they look at the makeup of the viruses. So far, I don't think there's evidence that there's been a big change that's caused a large change in the severity of the infection. That's something people will be monitoring for. I think it's fair to say that the big difference between whether someone gets a mild illness or a severe illness is mostly related to age. So it is people over 80, unfortunately, that have the highest mortality rates. And then people with underlying chronic illnesses, even hypertension, which is actually a very common chronic illness or chronic condition. So it's more to do with the individual and the way their own body reacts to the infection rather than different types of virus at this point.
Okay, thank you. And my last question then, and it's sort of more of a comment for all of us with Ottawa Public Health with our focus on healthy communities. You've addressed, Dr. Etches, some of the things that are being done, access to mental health supports, and I guess as we look to the future and pivoting that strategic plan, I imagine we'll be focusing a lot on the mental health of our community as we deal with the long-term effects of this in terms of PTSD, anxiety, depression, if we're already seeing signs of an increase in alcohol usage and that. So just, I guess, something we'll all have in mind if and when this levels off, and then looking at the health of this community, that is a priority.
Yes.
Thank you.
Thank you very much, Member Tilley. I am now going to ask the Vice Chair to take on the role of Chair so that I can introduce a motion that I've been working with OPH staff on with regard to community gardens. So can I get you to take chair virtually, so to speak, please?
Sure. So at this time, I'd like to call on Member Menard to introduce the motion calling on the province to exempt community gardens. Oh, sorry, actually, I am calling on Chair Eglai to introduce that motion. Pardon me.
No problem at all. Thank you. So I'll read out the motion, and then I'll provide a bit of background as to how we got here. So whereas on March the 30th, 2020, the government of Ontario issued an emergency order under subsection 7.0.2 sub 4 of the Emergency Management and Civil Protection Act with respect to the closure of outdoor recreational amenities. Whereas the list of specific outdoor spaces that are subject to the closure as found in Schedule 1 of the order includes all outdoor allotment gardens and community gardens. Whereas Ottawa Public Health believes that outdoor allotment gardens and community gardens are not only recreational amenities, given that in addition to providing a source of outdoor physical activity, they're also an important measure for increasing food security for many residents. And whereas outdoor allotment gardens and community gardens can be operated safely with physical distancing and other public health measures to prevent the spread of COVID-19, and whereas in Ottawa, there are local partners in place that are prepared to support the safe operation of these outdoor allotment gardens and community gardens based on public health guidelines to prevent the spread of COVID-19. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit direct the Chair of the Board of Health to write a letter to the Premier of Ontario and to the Ontario Minister of Health asking for their consideration in amending the March 30th, 2020 emergency order in advance of the 2020 gardening season to exempt outdoor allotment gardens and community gardens from the closure of outdoor recreational amenities in jurisdictions where public health measures can be implemented to support their safe operation to prevent the spread of COVID-19. So we have been hearing from many community groups and many individual residents throughout the whole city about, as spring approaches, about the importance of community gardens for food production as a perhaps a way to safely be outside and with the assistance of public health to create guidelines that would allow people to garden. And that may come in a variety of forms. It may be numbering of plots and even numbered days and odd numbered days, or scheduling of the individuals and when they can come and tend to their own plots, any number of things. But we heard loud and clear that this would be a positive way to be outside, and people really wanted to find a way to make it happen. So I asked staff to take a deep dive into this and see whether they thought this was something they could support. They thought that they'd be comfortable rather with coming up with guidelines and working with the community and allotment garden members throughout the city to find a way to make this happen. And I'm happy to say that staff came back after looking at it, discussing it, to say that they thought this was something that they in fact could do. So I think it's an important step forward with spring coming, and especially with May planting coming. If we don't get the seeds in the ground in May with such a short growing season that we have in Ottawa and the area, we'll be too far behind the curve. So I'm asking you to please support this. It's staff support it. It's community support it. Many people are on side with this and would like to see it go forward. So that's my pitch for community gardens. I hope you go along with me, and I'll be happy to take any questions that people may have about it, and we'll go from there.
Thank you, Chair Eglai. So as per our procedure, I will call on each member by name to invite questions or comments on the motion of community gardens. I'll start by saying I think I support this motion. I think it is a good way to promote healthy, active living as well as a food source, and I think that is something that we consider. And I appreciate the thought by the staff at OPH into how we can do this safely. So I would support. And I'll call on Member Bannon for questions or comments.
Hi there. I don't have any questions at this time, but I do want to echo my support for this motion. And I want to commend Chair Eglai for working with the staff and for coming up with a very positive solution. So congratulations, and I support this.
Thank you. Membre Cloutier?
Merci, Madame la Vice-Présidente. Thank you very much. Chair Eglai, do we have any idea of the guidelines, the general thrust of the guidelines that would be issued by OPH to ensure that there would be a safe operation of the allotment gardens?
So people still need to not gather in a group of more than 5 because that's illegal still under the province's order. And people need to ideally maintain that 2-meter distance from others. And so ways to do that would be to space out or schedule the time that people use a gardening space. And then we want to look at other measures that would decrease the chances of people touching the same things, touching the same tools. So looking to make sure people aren't using the same shared kind of equipment, or if they are, that we have ways to try to clean it. There's different measures. Our team is much more expert on the details than I am, but that's the idea.
Okay, thank you very much. And you anticipated my question. As a ward where there is a pretty significant allotment gardens along the Kilbourne corridor, indeed there is a lot of sharing of the tools, and so if we can ensure that we speak to that specific issue. Do we know of any other municipalities that have passed a motion or has entered into discussion with the province with respect to the application of the Emergency Act as it relates to community gardens?
I'm aware of other provinces that are allowing community gardens to operate, including Quebec across the river. And I do believe that the team here at Ottawa Public Health has had some conversations with the province that lead us to think that there could be some openness to this being a priority.
Thank you very much. Those are my questions. I will be supporting the motion.
Thank you. I'd just like to take this opportunity to remind everyone to mute their line. We are getting a lot of background noise. Chair Eglai, any further comments?
No, I'm good. Thank you.
Thank you. Member El-Shantiri?
No comments. I will be supporting the motion. It's a good motion.
Thank you. Member Gower?
I'll be supporting the motion. In fact, I was drafting a letter today to my MPP as well, so thank you for raising this.
Thank you. Member Kavanagh?
I want to say thank you very much to Councillor Eglai, or Chair, pardon me, Eglai, for this motion. My community members have spoke out loud and clear that they support this.
Thank you. Member Lakin?
Thank you. I completely support the motion in principle. I just have a couple of very simple questions. Number one, do we have assurance or a good sense of confidence that we're not offside with our provincial, with the provincial order in getting folks to go outside and potentially risk gathering? Number one. And number two, without seeing the guidelines from OPH about safe gathering, and we won't have time to see that, I'm just going to say that my support will be not contingent, but subject to the confirmation we'll get some real solid guidance for participants to do so safely. So just quickly, do we have confidence that we won't be offside provincially?
We do. We have part of the deep dive was sort of looking at where we think the province might be going, hope will be going. As my mother used to say, if you don't ask the question, you're never going to get the answer. So there seems to be great community support for it, and seems to be, a palpable benefit from a health perspective. So yes, I think it's something we will see, but I think the province needs to hear from different municipalities saying that they also are prepared to take on the challenge, and it is a challenge of providing appropriate guidelines so these things can be done safely.
Great. Well, with that in mind, then fully support it.
Thank you. Member Menard?
Yes, thank you very much. I'm supportive of the motion, and Councillor Ralston King and I have also written to our provincial representatives indicating the same, and just really very much appreciate the Board of Health's support for this as well. So thanks to the Chair.
Thank you. Maude Pinel?
Yes, I support the motion, and thanks, Chair Eglai.
And Member Tilley?
Great initiative, Mr. Chairman, and yes, certainly support this.
Thank you. So given the positive comments, do we have a vote to carry the motion?
Carried.
Carried.
Yes. Carried.
Any dissenting? Excellent. Thank you. And the chair is yours.
Thank you very much for covering for me. So the next piece is I'm going to ask Member Menard to speak to a motion, or introduce a motion rather, on the use of technology in contract tracing. So over to you, Member Menard.
Okay, thanks very much, Chair. Whereas contact tracing has been identified as a critical means of containing the spread of COVID-19, and whereas the process of contact tracing can be labor-intensive given that the local public health unit is required to identify, notify, inform, and monitor every person who is identified as a close contact of a confirmed case of COVID-19, and whereas the number of cases of COVID-19 continues to increase, so does the number of close contacts who require notification, information, and monitoring. And whereas leveraging technology has been identified as an option for facilitating the effective management of this public health emergency, therefore be it resolved that the Board of Health for the City of Ottawa Health Unit authorize the Medical Officer of Health to explore and adopt innovative digital technologies to automate some of the functions associated with the management of this pandemic, provided that such technology adheres to legislative and other requirements to safeguard the protection of personal information of individuals, including personal health information. Back to you, Chair.
I'm so aware of keeping the mute button on. I keep on forgetting that I have it. So thank you for that, Member Menard. We're certainly putting you to work tonight. Lots of reading to do without the benefit of having the screens in front of us. So are there any questions with regard to this motion for Dr. Etches or any other OPH staff?
I have a question, Mr. Chair. Eli.
Okay, so we will go through the list then, Member Secretary. Member Banham?
No questions.
Okay, thank you. Member Cloutier?
Thank you, Chair. No.
Vice Chair?
I guess I am curious is this a novel application, or this is something that that you're working with a third party on, or is this something that's developed internally at Board of Health?
I'm going to turn this over to Chantal Leclerc, who has been doing the research on options.
Thank you, Dr. Etches. Thank you, Chair. So this would be something that we're looking to work with a developer to develop. It's not something that we would develop in-house.
Okay, thank you. And then is it also, we've heard a lot in the media about using cell phones to trace location and then identify contacts that way. Is that one of the things being investigated, or this is something different?
No, that is one of the things that's being investigated. And so this would be something that people would voluntarily download onto their phones, and there would be safeguards in place around protection of information. And there's a way for individuals who test positive for COVID-19 to decide if they would like to make their location information available to public health. And so there's almost a double safeguard in the way that this type of application would work.
Okay, thank you. And is if somebody does not opt in, the traditional contact tracing would take place though?
Absolutely, and this is not intended to replace the work that the humans are doing. It's meant to support and augment. And obviously, especially in the initial days, not everyone would choose to use an application like this. And so absolutely, they would continue to receive the high quality care that they're getting through the contact tracers at Ottawa Public Health.
Perfect, thank you. No further questions.
Thank you. And Member El Chantier, you would indicate you had a question.
Yeah, I do have a question, and but if I can ask my first question after the last speaker about that, are we assuming everyone has devices, iPhones, and other technology? Is that what our assumption is?
So we know just from evidence that's out there that almost 80% of any population carries today devices, but we know that not everybody will, and we know that there are vulnerable groups who may not have access to cell phones, and that's why it cannot be the only way that we notify individuals, that we connect with individuals, we communicate with individuals, and we trace their locations. And so, as I mentioned, it will be a way to support the work that the contact tracers are doing, not to replace it. And certainly we are not assuming that everybody will either have access to a mobile device or will choose use an application like this, even if they have access to a mobile device.
Well, I'm glad you realize that, because I think in the outlying areas or rural area will be more than 80% don't have that device. I think will be a greater number don't have devices. And even if we have devices, sometimes we don't even have the technology to work. But anyway, I leave that alone for now. The question, my other question is, has this been seen happen any other places, or are we trying to be a pioneer in this one?
These types of applications have been used in other countries in the world, some with really good success. We're not aware of anyone in Canada using an app like this at the moment. There are certainly groups all over the country that are in the process of developing these apps. I've talked to most of them and have put some of them in contact with each other, so that we don't have a proliferation of tools, and that people are trying to maximize their efforts to come up with a solution. So we would perhaps be the first ones out the gate, and maybe that will help others to follow suit.
Okay, thank you for that. And Mr. Chair, when it's time to vote, I would like to call on the vote.
You'd like to call and vote? Okay, fair enough. Not a problem. Member Gower, please.
Yeah, no further questions. I was glad to see within the motion that there was the clause in there about privacy, and but I have no further questions at this time.
Yes, that was actually, Member Gower, that was a big discussion that we had. We knew that would be a concern for some people, so we wanted to make sure that was covered off in the motion going forward. Member Kavanagh.
No further questions. Thank you.
Thank you. Member Lakin.
Thanks, Chair. Just to reiterate Member Gower's question/concern, is the opt-in function sufficient to stay on side with federal privacy? Do we have a confidence that it is? And I'm hearing that the legal view is yes. The answer is yes, we're okay with that.
We will subject the application to an internal privacy review, and we're thinking about how we might reach out as well to the Provincial Privacy Commissioner to get some advice along the way. So as we finalize the development of the app and work with the developers, we'll be doing the privacy impact assessment hand in hand so that we make sure that we're on side every step of the way.
Great, thanks. And just a quick second question. Can this realistically get ramped up in a timely way that's going to be useful for us?
Yeah, we believe so. We've looked at an application that is pretty advanced. And what it requires is mainly some customization and making sure that it aligns with our workflow. So yes, in days, not months, we should be able to get something out.
Awesome. Is there any chance that the cost of this can get shared in some kind of joint venture way so public health financial risk can be minimized? Is there a joint venture opportunity here?
Yes, there may very well be. And we're also aware that there had been some funds set aside provincially for automating and digital solutions. So it's something that we're exploring, whether we might be able to tap into any sources of funds.
Thank you very much. That's all.
Thank you, Member Lakin. Member Menard, please.
No questions on this. Thanks, Chair.
Okay, thank you. And I should explain, my internet keeps on going in and out on me. It's been doing that through the whole meeting. So I apologize for the pauses sometimes, but it's because I lose documents because my system crashes. Member Pinnell, please.
No question, thanks.
Member Tilley.
No questions.
Okay, so it has been asked for a recorded vote by Member El Shantiri. Can I ask the Board of Secretary to please do that?
Yes, Chair. Member Bannum?
In favor.
Member Cloutier?
Yay.
Member El-Shantari?
No.
Member Gower?
Yes.
Member Kavanaugh?
Support.
Member Lakin?
Support.
Member Menard?
Yes.
Membre Pinel?
Oui.
Member Tilley?
In favor.
Vice Chair Di Giovanni?
Support.
Chair Aglai?
It's
Chair
carried
Aglai?
then. Oh,
Yes,
sorry.
that's
Carried.
10 yeas, 1 nay, Chair.
Not carried, rather. Support that motion, absolutely.
That's 10
So
yeas,
that-
1.
Thank you. So that's carried. I'm going to, again, prevail upon you, Member Menard. I think this is the most motions we've ever had in a meeting. If you could bring a motion on read the motion on non-medical masks, please.
Yes, so motion on face masks. Whereas we know that there is evidence of asymptomatic or pre-symptomatic transmission of COVID-19, and whereas community use of non-medical masks is a non-pharmaceutical intervention that has proven to reduce the spread of a person's own infectious respiratory droplets in situations where physical distancing is not always possible, thereby complementing other interventions such as properly washing hands, disinfecting surfaces, and physical distancing. And whereas Ottawa Public Health supports safeguarding the supply of medical-grade face masks and shields for use by healthcare workers and increasing the availability of non-medical masks for all members of the public to use when needed, and whereas until such a time as a vaccine may be developed and broadly available for the control of COVID-19 in our community, all non-pharmaceutical interventions should continue to be explored and promoted in order to slow the spread of infection and aid in recovery efforts. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit requests that the Medical Officer of Health and Ottawa Public Health staff work with partners to explore potential avenues for the large-scale production and availability of an adequate supply of non-medical face masks that would enable Ottawa residents to have access to non-medical face masks should they wish to add this to their own non-pharmaceutical measures for the prevention and control of COVID-19 in our community.
Thank you, Member Menard. And is that carried?
Carried.
Carried. Actually, I should have asked whether there were any questions, but it sounds like it's carried. So, no dissent. Okay, thank you. Then that's carried. We'll now vote to receive the medical officer of health verbal report.
I've got one motion on this one, Chair, unless you wanted it in a different spot, but I think this is the right place for it.
I don't have a problem with it, but as I indicated, or as I'm thinking here, if we could perhaps take, and again, nobody leave their phones, but if we could take perhaps a 5-minute recess, and I ask for that because Dr. Etches has been answering questions the whole time and has not seen the latest draft of your motion,
Sure.
Member Menard. So if we could take a 5-minute recess, and then Dr. Etches can have a quick look at the latest draft and see if she has any concerns or questions. Okay.
Can
We'll be back to you.
Can we see the final? Sorry, Mr. Chair, can we see the final draft? The rest of us, or it's not available?
Well, what I'd like to say is I would like to get Dr. Etches' input, and assuming she gives the thumbs up and doesn't require any changes, then we'll circulate that draft. But rather than circulating a draft and then perhaps having to send another one after that, so we'll take a 5-minute break and we'll go from there. Thank you.
Thank you, Chair. That now. Okay, so the motion is related to active transportation and pedestrian distancing. Whereas the City of Ottawa, along with Ontario, Canada, and the world, are currently experiencing a COVID-19 pandemic, and whereas this pandemic has witnessed all orders of government put in place emergency measures and guidelines to slow the spread of the virus and flatten the curve in order to preserve the health and lives of as many residents as possible. And whereas those measures include self-isolation, quarantine, and physical distancing, also known as social distancing, and whereas the city, the province, and the country are seeking cooperation from residents to adjust their habits, activities, and lifestyles to align with the guidelines relating to physical distancing, and whereas OPH defines physical distancing as taking steps to limit the number of people you come into close contact with, and whereas residents need to access essential services, including but not limited to grocery stores, pharmacies, medical offices, pet hospitals, and hardware stores, and whereas these essential services are often by design on our traditional main streets and arterials, and whereas many residents do not own cars and rely on active transportation to access these services, and whereas people continue to walk in the streets to provide distance between themselves and others walking on the sidewalk because of the perceived risk, and whereas City Traffic Services reports that traffic volume has dramatically decreased, while City Police reports that traffic speed infractions have increased, and whereas the City and the NTC have instructed residents not to venture outside their neighborhoods for non-essential reasons, while lanes normally reserved for metered vehicle parking have seen a large decrease in use. And whereas the Ontario Ministry of Health has stated that everyone in Ontario should do their best to avoid close contact with people outside of their immediate family. Close contact includes being within 2 meters of another person. And whereas the Public Health Agency of Canada has told Canadians who are not in isolation or quarantine that it is safe to go outside, run, bike, walk the dog, but that they should stay at least 2 meters away from other people. And whereas OPH has consistently recognized the need for residents to access essential services and has encouraged residents to go outside for their physical and mental health. And whereas the 2019 report from the City of Ottawa Planning, Infrastructure and Economic Development titled The Building Blocks for a Healthy Ottawa emphasizes the connection between active transportation and infrastructure and mental and physical well-being. And whereas on April 18th, OPH stated that our neighborhoods, sidewalks, streets, and multi-use paths are still available to get outside and get moving. And whereas OPH is on the record as supporting, encouraging, and promoting safe active transportation as well as complete streets, therefore be it resolved that the Ottawa Board of Health formally express its support of the Medical Officer of Health's professional advice that physical activity and getting fresh air are important for overall physical and mental well-being, and that you can still go for a walk, run, or ride your bike in your neighborhood on shared paths and through your local park. And be it further resolved that the Ottawa Board of Health also express its formal support for the City of Ottawa, federal and provincial governments to increase the amount of safe active transportation space outdoors for residents, including when accessing essential services, to improve their physical and mental health while still adhering to all municipal and federal guidelines related to physical distancing, as well as provincial regulations and emergency orders against not assembling in groups of more than 5 persons. So I'll leave it there, Chair. Thank you for your back and forth on this and support. Chair, are you there to go back to?
So, Member Banham, are there any questions?
I'm just wondering if Dr. Etches or any other staff could comment on any of the perceived risks, or whether staff are fully prepared to support this motion as well, or ready to support this motion if we were to pass it today.
Yes, I'm in support of this motion. I think this is something I've said before is in the therefore be it resolved clause, and when it comes to the second be it further resolved, you know, I think this is something we're trying to do with the City of Ottawa in conversations, you know, in terms of what's feasible to do in our city. We haven't reached out proactively to the federal government, but we've been working with the MCC, which is federal jurisdiction, around some of their ideas for physical activity space. And provincially, I think it aligns with what we were talking about earlier to try to express the desires of the community, you know, to the province as they're thinking about changing their orders. that this is a priority area for people. So I'm happy to continue those conversations with all levels of government.
Any further questions, Member?
Just more of a comment that I think that this motion is very beneficial. Increasing spaces like this is very beneficial for people who perhaps live in smaller spaces or in apartment buildings. So I think that it's really important to support motions that allow them to get outside and continue their exercise, which helps with both physical and mental health. Thank you.
Thank you. Member Kuche.
Thank you very much. No questions.
Okay. Vice Chair.
No questions from me either. Thank you.
Thank you. Member El Chanchiri.
No question. Happy to support it, actually.
Member Gower.
No questions. Thank you.
Member Kavanaugh.
Very much. I appreciate the motion being forward. As you know, Chair, I forwarded you some information regarding what's going on in Calgary, where they have already implemented closing streets, and also they got rid of beg buttons as well. So these are things that are going on everywhere. This is opening up the door of possibilities, and it's not for everywhere, but it's good for strategic spots, and it's not meant to encourage people to travel to other parts of the city. So I appreciate that, because that's important, that we recognize that people stay in their communities, because that's part of it, and to keep physical distancing. So thank you very much for putting this forward.
Member Lakin.
Thank you. Thanks for putting forward the motion. I support the idea. I'm looking for some reassurance that in the first paragraph that it's resolved that folks can still go for a walk, that the message of doing so safely can be communicated. While I see paragraph 2 talks about compliance with orders, etc., I'm looking for some reassurance that encouraging folks to do the things we know that are good for them but ought to be done safely gets communicated. So can someone just comment on that?
Are you asking Member Lakin for a friendly amendment to insert the word safely, or you just want to hear from Dr. Etches or the staff as to that they're comfortable with that message? I
think I would be most comfortable to see the word safely in there, as it's common language, while paragraph 2 is legalese.
Well, I'll turn that over to Member Menard to ask whether he would accept a friendly amendment in that regard.
I fully understand what the member is saying. I just, in the first be it resolved is a quote from Dr. Etches. So I don't know, I can't change the quote, but certainly
no, that we don't want to do that.
No, but that be communicated in a safe manner. I fully agree with that, and I support that.
So is that sufficient, Member Lakin? You've got the mover saying it. I think we can get Dr. Etches to say it on the record as well. And I appreciate the difficulty of amending a motion that you know, in effect is quoting. You can't change the quote. Dr. Etches, can you weigh in on this for a minute?
Well, I probably, if you extended the quotes to what I said before and after those quotes, I probably did say something about maintaining physical distancing in order to do it safely. So that would be in line with my usual advice.
Is that satisfactory, Member Lakin?
Yes, it is completely, and that's helpful. Thank you very much.
Thank you. Member Menard, did you want to speak in any more detail to your motion, or you seem to be on a roll here? So.
No, thank you. I appreciate the support. Thanks very much, Chair.
Okay, Member Pinnell?
No question, and thanks.
Okay, Member Tilley?
Yeah, I certainly support it. I don't know if it's covered in Dr. Lakin's concerns, but in that second bolded, be it resolved on the second line, it says federal and provincial governments to increase the amount of safe, active transportation space outdoors. But if you wanted it more in the first bullet there under Dr. Etches, maybe it emphasizes it more.
Okay. I'm gonna talk very briefly to it. I want to thank Member Menard, as people may have gathered from asking for the small recess. This is not the original motion that was put forward. There was a discussion going on back and forth between myself and Member Menard while the meeting was going on, off and on. And so I want to thank him for being amenable to some suggestions coming from staff and coming from myself on this motion to end up with the results that's in front of you right now. So thank you for that, Member Menard. And I also will be supporting this motion. Carried?
Carried.
Carried.
Any dissent?
Carried.
Okay. So now we will vote to receive the Medical Officer Health verbal report as amended by the various motions. Carried?
Carried.
Carried. Carried.
Okay. Any dissent? Okay, thank you. We will now move on to the next item, which is Ottawa Public Health submission to the Government of Ontario on the potential for cannabis consumption, establishment, and or cannabis special location permits. What we'll be voting on is that the Board of Health for the City of Ottawa Health Unit receive the Medical Officer Health submission to the Government of Ontario's consultation on oh, you know what? I'm just getting a note here from our secretary reminding me that we did already carry this on consent. So thank you for that, Sian. It's been a long meeting so far. I appreciate the little prodding there. And we're now on to item number 5, which I also believe was carried on consent, which is our submission to the Ministry of Health on proposed vaping regulations. Number 6 was the strategic plan. That was also carried. Number 7 was the Ministry of Health accountability and reporting requirements activity report. That was also carried on consent. Number 8 was 2019 operating budget year-end results, Board of Health for the City of Ottawa Health Unit status report. That was also carried on consent. As was number 9, the delegation of authority for contracts awarded for the period of July 1st to December 31st, 2019. Member Menard, can I have you please read the motion to adopt reports?
Yes, thank you. That's agenda item 10, motion to adopt reports. Il est résolu que le rapport global du président du Conseil de santé, le rapport global de la médecin-chef en santé publique et le rapport intitulé Soumission de santé publique Ottawa présenté au gouvernement de l'Ontario quant à l'éventuelle création d'établissements de consommation de cannabis et au permis de circonstances liées au cannabis, soumission de santé publique Ottawa au ministère de la Santé de l'Ontario au sujet de la réglementation proposée sur le vapotage, plan stratégique de santé publique Ottawa pour 2019 à 2022, mise à jour de 4e trimestre 2019, ministère de la Santé de l'Ontario, responsabilité et exigence de déclaration, rapport d'activité standard T4 2019, l'exercice du budget de fonctionnement de la fin de l'exercice 2019, rapport d'étape du Conseil de santé de la circonscription sanitaire de la ville d'Ottawa et délégation de pouvoir, contrat accordé pour la période de 1er juillet au 31 décembre 2019 sont reçus et adoptés.
Thank you, Member Menard. Carried?
Carried.
Carried.
No dissent?
Carried.
Thank you.
Carried.
I'm not aware of any motions requiring suspension of the rules of procedures. Anybody wish to bring any forward? Okay, thank you. Any notice of motion for consideration of the subsequent meeting? Okay, thank you. And Member Menard, back to you again to move the confirmation bylaw motion.
Okay, thank you, Chair. Be it resolved that confirmation bylaw number 2020-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 20th, 2020 be read and passed.
Thank you. Is that carried?
Carried.
Okay. Any dissents? Thank you. Any inquiries? Thank you. I just want to mention before we adjourn that 15 minutes from adjournment, there will be media availability by way of telephone. And again, before I adjourn, I want to thank all the members and the staff that participated in this first ever virtual Board of Health meeting. You know, I think under the circumstances, it went of, you know, not muted phones, you know, internet going out, rural internet issues. I think we can all, you know, pat ourselves on the back. I think under the circumstances, it went very well. And I want to thank you all for your patience and cooperation in moving this meeting forward. So I'll call for adjournment. Carried?
Carried.
Carried. Okay. I'm assuming no dissent. And finally, our next meeting is scheduled for Monday, June the 15th, 2020, again at 5 p.m. Thank you.
All right, just a reminder for everyone to go on mute, please. Good evening, bonsoir. Thank you for joining us for the media availability regarding today's Board of Health meeting. Merci de vous joindre à nous pour ce point de presse au sujet de la Réunion du Conseil de Santé. Before we begin, a reminder to please place your phone on mute until I invite you to speak, and please do not place the call on hold at any time to avoid broadcasting your hold music on the call. Veuillez vous assurer que votre téléphone est sur silencieux, sauf lorsque c'est à votre tour de me poser votre question. Et s'il vous plaît, ne jamais mettre l'appel en attente. Please note, Dr. Etches, Chair Egli, and Ottawa Public Health staff are on the line and available to respond to your questions. Dr. Etches, le président du Conseil Keith Egli et d'autres personnels de santé publique Ottawa sont disponibles pour répondre à vos questions. I will quickly read through the list of media who have registered. Or, sorry, I've already done that, so I will skip that. So if I haven't missed anyone, then we'll get started. So I will invite each agency in alphabetical order to ask their question. Please remember, you have one question and one follow-up. If we do have time, we can do another round. Alors, nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We will start with CBC's Natalia Goodwin.
Hi, thank you, Dr. Etches. Just one question. You did talk about, and we have been talking about all day about our, how we are not reached our peak. Could you give us an indication of where we're most vulnerable now in terms of stabilizing and declining of hospitalizations and stabilizing those numbers?
Right now, the place where we see outbreaks are long-term care homes and retirement homes, and some of those may result in hospitalizations. We do see other outbreaks in the community where people are having difficulty keeping 2 meters apart. So in workplaces where the nature of the work is that people are in close quarters, but those tend to be people who are younger in those workplaces, and they're not leading to the same kinds of hospitalizations. And then other hospitalizations are people in older age groups. This is a tricky virus. It's a hard one to contain because of the asymptomatic spread and the pre-symptomatic spread. So all of our actions still do make a difference to keep it out of the homes of older adults and out of our retirement homes and places where people have to live in a more congregate setting. I think there's something that is visible if you look at the provincial trends and you look at our modeling as well. It shows a slower decline than the rate of increase. So we saw, a rise in the curve that was steeper than we're probably going to see on the other end. It's going to go down more slowly. I think that we are seeing very much a stable picture there, and hopefully if we can continue to keep the long-term care homes and retirement home situation improving, then we'll also see that in the hospitalization.
Okay, and just thank you for that. And follow up on that, on a similar call last week, Dr. Remediotis in the Eastern Health Unit said about long-term care homes that he thought they should be kind of the last places to open up to visitors. Would you agree with that assessment as we go forward and start to open things up?
I agree with Dr. Remediotis that we need to protect the populations that are most vulnerable for a longer period of time. Absolutely. And that can include long-term care homes and retirement homes, yes.
Thank you.
All right. Thank you, Doctor. Thank you, Natalia. CTV's Josh Pringle, go ahead.
Thank you very much. Dr. Etches, you said during your presentation tonight that Ottawa Public Health was running about a $750,000 a month deficit. Quick clarification, is that just from the start of the pandemic, or is that each month of the year? And also, are there ways that you can look at to trim that deficit down as you get into the latter half of the year?
I believe that started as we ramped up our response in March. And I can ask Lou to chime in a minute if he has anything to add. So certainly for March and April, that's looking like the figure is large. That comes from having increased our staff by 350 and having to pay overtime hours for our usual staff. This is a large operation. And so what people are doing is likely to be necessary for a longer period of time. So they're answering phone calls and questions from the public, from healthcare providers. They're doing the case and contact management, and they're handling outbreaks. And they're reaching out to all of the partners and priority populations that have questions and need communication support. And they're creating communications products for all different kinds of things. So it's work that's going to continue. I don't know if it will continue at this pace in terms of hopefully we'll get the communication product settled down. We'll have reached out to the partners that, the questions will be answered more so. But the case and contact management, that is a key tool to keep this outbreak under control as we relax restrictions. And so I think it is something we need to have in place, and even we'll need to watch the number of infections as we ease up on restrictions, how much that rises, and we may even need a larger team for case and contact management. Again, hopefully the outbreaks will settle down in long-term care homes or retirement homes now, but we still need a team to be able to really get on and prevent, and then also work to help people control outbreaks in community settings. So if we projected it for the rest of the year, I would say it gets less likely that it's an accurate projection to continue to spend that amount every month to the end of the year. Clearly that's a large figure if it's kept up till the end of the year, over 5 million. And I don't have a lot of confidence in that figure yet, projecting out that far.
Okay. And the $750,000, you said that also includes like a loss of revenue from other programs that had to be canceled along the way or shut down because of the COVID-19 pandemic?
Right. So we're not doing dental clinic services at all of our locations. We've cut back the locations. We're not providing sexual health services where there's a little bit of revenue comes in from sale of contraceptions. We have a lower rate of immunization than we usually would provide in schools because the schools are closed. Our food handler courses are canceled. So those kinds of things. We don't make a lot of money in public health. Those revenues are not very large. But we are doing what all organizations are doing. If you're trying to steward your budget, you do look for areas where you can cut back on spending. So we have cut back, on things like professional services, training, development, travel, all of those things. We're trying to find savings where we can, but clearly it's a big gap to make up.
Thank you.
Great. Thank you, Doctor. Thank you, Josh. Radio-Canada, Dominique Descrest, à vous.
Oui, pendant la réunion, il était question d'utiliser des outils numériques pour aider avec les enquêtes épidémiologiques. Il était question notamment d'une application qui serait en développement. Je me demandais, cette application-là, elle est développée uniquement à l'interne à la ville ou c'est développé en partenariat avec des entreprises, je dis ça comme ça, mais peut-être Facebook ou Google ou des entreprises comme ça qui font des applications aussi.
Andrew, est-ce que tu es là pour aider avec cette question, s'il vous plaît?
Oui, Vera, merci, c'est Andrew Hendricks. Je suis directeur avec Santé publique Ottawa. Je vais répondre, puis après je vais demander Vera si tu as quelque chose à ajouter. L'application qu'on parlait à la réunion avec Santé publique, c'est une application à l'externe. C'est une compagnie qui a créé une application spécifique pour aider les santé publique puis des départements de santé à plusieurs niveaux du gouvernement pour aider à faire le suivi avec les cas qui sont confirmés avec le COVID-19 ainsi que les contacts qui sont proches. Comme Vera a expliqué, Il y a beaucoup de suivi à faire avec chaque cas. C'est du travail qui prend beaucoup d'énergie avec nos employés. Puis l'application va nous aider à faire plus de suivi à travers l'utilisation de l'application. Ça va être une application qui est volontaire. Fait que ça va demander à la personne avec leur téléphone de télécharger l'application. Puis on fait sûr que c'est fait en forme que l'information soit qui reste privée. On travaille encore avec plusieurs personnes pour faire sûr que l'information reste privée sur leur téléphone. Puis l'utilisateur de l'application a besoin de déclarer si jamais ils sont infectés avec le COVID-19 pour travailler avec Santé publique pour donner la permission de trouver et de voir où la personne a circulé dans la communauté si jamais ils ont circulé. Puis ça donne accès à Santé publique de faire le suivi avec leurs contacts qui sont plus proches.
Parfait. Et question de suivi. Pour ça, quand est-ce qu'on sait, est-ce qu'il y a un échéancier pour la sortie de cette application-là? Est-ce que c'est une question de semaines, de mois? Est-ce que vous avez un genre de timeline pour l'instant qui est établi?
Oui, ben ça fait déjà une couple peut-être une semaine ou deux qu'on travaille sur juste voir si l'application peut nous aider avec nos objectifs à Santé publique. Fait que ça va prendre encore un petit peu de temps pour qu'on soit prêt à le démarrer avec nos employés. Mais on espère qu'on peut l'utiliser bientôt, dans les prochains jours. Il faut aussi travailler avec avec le gouvernement d'Ontario, le ministère de la Santé, pour faire sûr que toutes les différentes juste pour faire sûr que tout le monde est bien avec ça. Mais on espère de faire ça dans la prochaine semaine.
Merci.
Parfait. Merci Radio-Canada. Merci, Andrew. Sue Sherry, you have a question?
Yes, thanks very much, Dr. Etches. Two questions. I've been reading a lot lately on Twitter, which, clearly isn't the best source of information, but people are suggesting that you've made an edict about traveling outside of your neighborhood, and I'm trying to understand what your message actually is. And when I say neighborhood, I mean, is there a danger for me to, go downtown and walk on a certain road or that sort of thing?
No, I don't think I have personally said anything about your neighborhood. I'm not sure. People may be getting that idea from my overall message, which is to try to stay home and just go out for essential reasons like groceries and pharmacy and physical activity. But physical activity is something that can take you out of your neighborhood. Sometimes people go to groceries in different places because the lineups are better. So I don't have an edict or a position on neighborhood. No.
Thank you, Dr. Etches. Susan, do you have a follow-up?
Yeah, well, yes, I do. I guess I have an aunt who is in a long-term healthcare facility, and I know that they're all being, they have to stay in their rooms for the most part. It seems to me that, with people of that age, with all of us, but certainly with people of that age, there's a great risk to their mental health. I'm just wondering what your thoughts and advice are on that.
Yes, I think that it's important that as the province is focusing on long-term care homes and retirement homes, and the hospitals are helping with staff, that some of that capacity is used to help with the social needs of residents. So, the nurses in long-term care homes, retirement homes are so busy trying to provide care that they may not have the time to, sit with someone and share a message from their family or help them see their family in photos or video. So I think this is a kind of whole person support that we're.
Sorry, I missed that word. It's the kind of what?
Whole person. We need support for the whole person, their physical and their mental health. And so if as we're able to add in some staffing resources to long-term care homes and retirement homes, it may enable some more of that social support to be provided. I know people do try to find creative ways to get messages to their family members and share things, and so that's something that I'm bringing to the table as the health system looks at how to best support long-term care and retirement homes.
But are you not worried about the interim now? I know it's not all on you.
That's underway. No, that's not. It's underway right now. There's active addition of staff to long-term care homes, and so family members, if they have other suggestions for us about how to support their family members' mental health, we're welcome to take those and promote them as well.
Thank you very much. I appreciate it. I'm sure you're exhausted.
Thank you all.
I appreciate it.
Just wondering if there's any extra questions from media. Média, avez-vous d'autres questions ce soir?
I do just have one quick one. Natalia.
Go ahead,
BBC,
Natalia.
Sorry. Thanks. Dr. Etches, in terms of the automation tool that you guys are looking at for tracking, a couple of weeks ago, there was an announcement that 1,000 people may be moved over to OPH from other city departments to help with that work. Has that happened?
We have. I don't know if I have the numbers right in front of me. We have definitely relied on the City of Ottawa redeploying staff to Ottawa Public Health. I'm going to just say, so 30% of the staff working on our response right now are from the City of Ottawa, and I don't have that exact number, but it is not 1,000, and it's probably not going to be 1,000. Those projections were made early on when the curve was still increasing more steeply, and we were estimating the worst case scenario of the number of cases that we would have to track, doubling, every 3 days. Now the cases are doubling every 11 days or so. And so we're not seeing the same demand for case and contact management necessarily into the future. So we've revised our projections down for the number of city staff that we would love to be able to have join our team and help us. That said, we don't have all of the information we need to have really strong projections because if the testing capacity continues to go up, and they continue to add more testing, we'll still probably continue to see the number of cases go up, and that's more work than to follow up with those cases and do the contact management. So it could continue to increase, but for now we've revised our projections down. 200 to 400, I think, is the worst case scenario.
And if you are able to get this tool on the go, I would assume that would help with that number and maybe help with getting the budget back in order?
Definitely, yes, that would be the hope, because and like the first use is to have timely response so that people can be notified right away, automatically. Right now we have to interview, get a phone number, get phone numbers, track people down, reach them. Then interview them. So there's a lot of also speed that could be added to the response potentially, but with a tool. But yes, also hopefully decrease the hours of work.
Okay, thank you.
Hi, Vera. It's Andrew here. I'll just add to your comment just to say that it's approximately 140 city employees who have been deployed to provide support to Ottawa Public Health's COVID response. And just to add to your comment about just the use of this application, it's not meant to completely replace the good work that our public health staff are doing in terms of reaching people who are affected by COVID-19. It's meant to amplify some of the work that we can do and speed up and make us a little bit more efficient when the user had access to a phone. And so we do see the work happening together with the PHNs as well. When I say PHNs, it's public health nurses. So.
And sorry, just to clarify, is it only people who would have tested positive that would be using this app, or everybody in the city could use it?
Yep. So I can.
I'd like to follow up on that. Oh,
Sure.
sorry.
Yep.
Didn't mean to interrupt.
Go ahead, Andrew.
Yeah, sure. So the application is it's the user, so the person with the application would have to agree to download the application so that they consent with the use of this application, and so they download it to their phone, and then once if they develop symptoms and they decide to go for testing through the health system. We could find out, so Ottawa Public Health would be aware that this individual would have tested positive. So that would kick off a process where we would normally follow up with them under normal circumstances to talk to them about their diagnosis. At that point, we would be able to engage them to see if they've downloaded the application. And in that situation, we would have a conversation with them to see if we would be able to, or if they would be open to enabling the locating function. So basically it tracks where they've been in the last 14 days, and that would be done on a consensual basis. And that would give us access to potential contacts in the community. The other way to do it is if a user downloads that application and then they find out that they test positive for COVID-19, they can also decide to share that with the public health authority like Ottawa Public Health, and then it would prompt them through a process in which they could then turn on the locating feature to that, which then gives us access to their whereabouts over the last number of days while they've been symptomatic or pre-symptomatic. So there's a couple of different ways in which we can use that application to do more to reach the community.
Okay, great. Thank you.
Thank you. Andrew,
Sorry,
are
can
there
I
any
do a
further media
follow-up?
questions?
Yeah, I'd love to do a follow-up with Dr. Etches.
Go ahead, Susan.
We keep on hearing a lot about, and I'm talking about the media as a whole, not specifically Ottawa, but, the flattening of the curve. Are we going to see, has the worst come yet, I guess is my real question. Is it going to get worse before it gets better?
So in terms of the rate of hospitalization, I think for the general population, the worst is over in this first wave. And hopefully we can keep it that way for the general population. Unfortunately, for long-term care homes and retirement home residents, we are seeing more facilities affected. The number of outbreaks has grown over time, and some have resolved. Some of the outbreaks have resolved. We have 4 resolved, but there are still 19, and the risk of more being added. And so that, unfortunately, the worst is not over for that community of residents. And what we need to be careful of going forward is that we relax restrictions in a way that still protects us from a big spike of infections, because most of our population, maybe even 99% of our population, is still not immune, has not been affected by the virus. And so that's a risk as we go forward if we're not careful.
Great. Thank you, Doctor.
Is there a concern that when people, my fear is, and I am not a medical professional, but my fear is that when people hear the thing about flattening the curve and the numbers, leveling out, that people aren't as careful as they should be. Is that a concern you have?
It is, because it's not like the virus has disappeared, right? So we know that there are still a lot of infections out there in our community. They're not measured, they're not lab tested, they're out there. And what's protecting us right now is the physical distancing. So flattening the curve doesn't mean that we've got all the infections down to 0. It means that we're managing it. And so we do need to maintain physical distancing, even as we relax some of the restrictions. And that's why we spoke about masks as well tonight at the Board of Health. There's other layers of protection that we can add that will help us as we think about other ways to go about our activities.
Great, thank you. So we just had one request for Andrew Hendricks. If you could please spell your name and also your title, that would be great.
Sure. Hendricks' last name is Hendriks. No C in Hendricks. And I'm the Director of Health Protection.
Thank you. And that's all the time we have for tonight. C'est tout le temps dont nous disposons aujourd'hui. Thank you so much for attending. Thank you. Merci.
Thanks so much.
Thank you.
Keith Egline.